Yo, what the deal? Yo, bro, I don't know why. I don't know why it looks like that. Let me see if I can share it. Can I share it? I sure can. Let's see what I got. That's okay. Oh, shout out to the one person that's up in here. Shout out to y'all. Hey, welcome. Today is Wednesday. Today is Wednesday, hump day. Whatever you want to call it. Hump day. Hump day, Wednesday. Woo woo. Shout out to y'all. I got two people up in here. Hey, welcome. Hey, if you're new here, let me know who you are, where you're from, where you're at in your nursing journey. We're going to wait for a few other people to get up in here. I got two people that are sitting in here watching. Y'all got any questions about anything nursing related, NCLEX, ask me anything. Go ahead and ask me. Let me know what's up. Go ahead and ask me. So, waiting for a few people to jump up in here. I know I'm maybe 1 or 2 minutes late or something like that, So, we just kind of up in here just chilling. Your boy just got off work. And he has a massive headache because it was quite eventful today. But we ain't here to talk about all that. We here to talk about nursing, NCLEX, and then whatever issues y'all got going on, or if y'all want to just be nosy. You know what I'm saying? So welcome to everybody that's in here. Pathophysiology, the best way to study. There's a lot of good YouTube videos that are out there for pathophysiology. Remember, pathophysiology is the study of the disease processes and how they affect the body, right? Honestly, patho was one of my favorite subjects when I was in nursing school. Actually, it was a prereq before I got into nursing school because I went for my BSN. So definitely some good YouTube channels like Khan Academy. Can't go wrong. I'm from Mississippi. I just reapplied for my PN program. Shout out to UCJ. Don't be giving up on there. The thing about it is just nobody's ever going to know how many times you applied. Nobody's ever going to know how many times you got rejected. Hey, go out. Hey, people need to stop playing. Stop playing with me, number one. Number two, hey, go out there and do you. Go out there and do you. How do you handle not backhanding people at work? Look, let me tell you, Joseph. It takes a lot. It takes a lot not to just, uppercut people. And plus, I don't want to go to HR. You know what I'm saying? Ain't nobody trying to do all that. So patho is similar to micro. It is. But rather than, learning about the cells and all that other good stuff, you learn, although you have that, you learn about how it affects the body. And when you learn about how it affects the body and how the disease process works, when you get to the nursing aspect of taking care of a patient, you're going to be like, oh man, I remember how that works. Especially if you think about somebody who has end stage renal failure. You start to learn about the ascending loop of Henle and the distal convoluted tubules and how those are affecting what disease processes can come from when those are messed up. You know what I'm saying? So that's one thing I loved about patho. That's probably one of my favorite classes. So Khan Academy has a really good one. I usually have a really long list of other YouTube channels that I recommend for people, but I never have a way to put it up here. So it's just like that. Shout out to all 24 of y'all that are up in here. If you guys are new to the live stream, my name is Kevin. I go by the Boot Nurse on all social media channels or platforms. So YouTube, Instagram, X, gonna give it to you. You know what I'm saying? Thread, well, that's, we eating out here, but Thread, I think that's Thread right there, right? So make sure you guys go over there and check that out. If you guys are new here, if you're a brand new nurse and you want to get a jump on NCLEX, check out the 7-day NCLEX course. That link is in my bio for $48. Once you get it forever. It's in the pre-launch phase. We're always upgrading and updating stuff. NCLEX style questions are going to come in there. I'm going to be doing videos on how to answer NCLEX style questions to include the new generation NCLEX, which of course went into effect April Fools. And no, this is not a joke. This is not a game. Okay. So, if anybody's interested in getting a jump on their NCLEX now, either RN or PN, the 7-day NCLEX course, link is in the bio. Check it out. Why they treat PN so bad. You know what? Honestly, I'm not even gonna lie to you. I feel like it's a dick measuring contest. Would you ever go back to be a CRNA? B, I think we talked about this before. My love and my passion is not to do CRNA, at all. I'll give you an example. I went up to the ICU, and when you walk in the ICU, you already know what's about to happen. You smell it. You can feel it in the air. You're like, something bad is about to happen. And when I say bad, I mean a code, code blue, what shit's about to start popping off. And so I'm just like, okay. I don't like this. I hear alarms. I look at monitors. I'm just like, okay, he had 60 whatever. Next thing you know, like he Brady down, which obviously means his heart rate started to drop. And I'm just like, all right, well, I look like my guy's about to code. And as soon as I was explaining that to a student, patient code, and I'm just like, I don't want to be here. And obviously, what are the things that are happening right now? There's a spike in the Rona. I can't say the other word because then I might get in trouble. What's up, hospice? Welcome. I knew you was going to be here. You better start sharing and letting folks know that we out here. Hey, as a matter of fact, I got 72 of y'all. First of all, I need 72 new friends as of right now. And I need 76 of y'all. There's 76 of y'all. And I need y'all to smash that like button. You want to know why? Because you love me. You see what I'm saying? Because you love me. You love the fact that I'm here and I'm looking rugged and I got this stuff going on and I had a rough day. You love me. Share it, like it. I love you. What's up, beautiful? What's up, Blanco? I appreciate you being here. Hey, so we're going to talk about nursing news today. Today is Wednesday, right? And then you guys may be mad at me. You may be mad at me, but I didn't prepare any NCLEX style questions today. I know. I'm terrible. I'm a terrible, terrible person. However, I did find a really good website that does have like comprehensive type of questions. They may not be new generation NCLEX style questions, but nonetheless, the questions are there. Because remember, I said it's all about making yourself familiar. I should be able to give you any type of question and you should be able to answer it based off of the content that you've already learned. I think we've all agreed to that, right? And even if you don't, there should be those keywords that stick out to you in the question that should give you the answer. I would think, right? So we're going to go over those questions. Once I find them, we're going to talk about nursing news and we're going to talk about y'all. I'm always here. First of all, it's always about y'all. That's the only reason I do the NCLEX style questions. That's the only reason I do, I do TikTok is because it's all about y'all. You said no problem. Hospice, look. I appreciate you. I appreciate you being here. But I like to do the NCLEX style questions because it's for y'all. I love the info. Nursing school is scary to me at the moment, but I really want to do it. Then do it. There should be nothing that stops you. PN can be helpful in the hospital setting, but I'm going to get my RN. I do want to be an ICU nurse. Well, shout out to you, CJ. Go do that. There should be nothing that's stopping you from wanting to go do that. Being an LPN or being an LVN, whichever, they're interchangeable. And a hospital is great. You get the hospital setting, you get the hospital training. As an LPN, you don't only belong in a long-term care facility or a nursing home. Like in my hospital, there's so many like LPNs that are on oncology and they work in the surgical med surge. They work in tele. They work all those different places, right? So. If you're a PN and you're doing that, get your stuff together, get your settings down, get your time management, get into it. And then, go back to get your RN and then, go do ICU, do the critical care. And that's another thing I tell people. You can go straight to critical care right out of school. Don't let these nursing schools and let these nurses tell you that you can't do that or you need to go to med surg. No, you don't got to do all that. You ain't got to do all that nonsense. You ain't got to do all that nonsense. All right. But shout out to all 38 of y'all that are in here. Hey, I want you guys to smash that like button. And I want you guys to. Thanks for that. I appreciate that. But shout out to all y'all that are in here. If you guys are new, thank you. Thank you guys for being here. And welcome to the stream. I want to know who you are, where you're from, where you're at in your nursing journey. What questions do you have? Are you a nurse? How long have you been a nurse? Nursing student? Pre-nursing student? Taking that NCLEX? How many times? If you passed the NCLEX, let us know. That way we could give you your flowers because we, as all people that are in here that have either taken the exam, was not successful, and us that have been successful, we know how tough that exam is. So let us know. Let us know what's going on. My co-hosts are not here yet. I'm waiting for them to get here so that way I can introduce them. So who is that? It says, Yanni, you a travel nurse? What kind of travel nurse are you? And speaking of travel nursing, so many people are saying that travel nursing is dead and the money ain't the same. I can tell you right now, the money ain't the same. You ain't going to get those Rona numbers of 10K a week. Y'all better stop playing. And you already know that with those Rona numbers come that Rona craziness. So sometimes 10K a week may not be worth it, especially for your mental health, right? So think about that. But hey, the Rona numbers is going up because of, the Rona is going up. So be aware of that. And plus, hey, we're getting in the flu season. So a lot of people are exhibiting those same signs and symptoms that the Rona has when it comes to the flu. Just saying. Hey, from Ohio, 6 weeks away from taking my LPN exit. Shout out to you. Is it Keisha? Keisha. Shout out to you, Keisha. You're going to do all right. You're going to do all right. You're going to do all right when you take that. Yanni said you're doing med-surg telly. All right, cool. Shout out to you. Hey, and that's another thing too, is like everybody's always saying like, hey, the specialties are the ones that always get paid a lot. I can tell you right now, I saw some med-surg nurses, med-surg tele nurses that they were paying like $6-7 a week. Like legit $6-7 a week. And ICU nurses were getting paid like $4 a week. You want to know why? It's because of the demand of what they need. They need med-surg nurses, so they're going to give you that I need you money. So think about that. Okay. So every aspect of nursing when it comes to bedside is always going to be critically needed in some way, shape, or form at the bedside. Always. She said, yes, thanks. I appreciate it. Yeah, of course. Hey, so that's another thing. We foster a great environment down here. Like if anybody, like nobody's going to come into my chat and they're going to act a fool. So there's one thing I say, and I adopted it from another YouTuber. He was just like, his name is the Black Hokage. So shout out to all of my people that are big anime heads up in here, right? So he pretty much says that if you come into my chat and you act a fool, you're getting a 600. A 600 means 600 seconds, which equals 10 minutes. And that's how long you get banned. I just like saying 600, but when I ban you, I'm banning you forever because you're not going to come into my chat. You're not going to act a fool. You're not going to berate or be toxic to nobody. You're not going to do none of that. So if I'll tell my moderators, I'll be like, hey, Nelly, whoever that is, 600. And sometimes I don't even got to say it because she'll just block you. So come over here and act crazy if you want to, getting a 600. All right. Love you. Appreciate it. Limo says, what's up? How are you? Hey, fellow nurse. I love seeing black male nurses. Girl, me too. And by that, I mean me. No, I appreciate you being here. Thank you. Is it T? Yeah, I appreciate you. Zaria says, hey, how are you? How do you feel about LPNs in the hospital? First of all, Zaria, I love LPNs. Never will I ever shit on an LPN, ever. I can tell you I worked in the ICU for a total of a year from different ones. And when I did have an LPN, it was great. When I never had an LPN, I would be like, bro, I really need some help out here. Like straight up. So when it happened, it was great. When I didn't have them, look, I'm just saying, like I loved them when I had them. Straight up. The color looks cool on you. Oh, is it? So I don't know what's going on with the color, the saturation of this thing right here, what we call TikTok and the camera. But this is like a light blue. And then maybe it's just, it's making my melanin just, you know what I'm saying? So I appreciate that. But hey, this is what I'm here for. Let me see what's going on. Kate said just got accepted in the LVN school. Shout out to you, Kate. Everybody give Kate some flowers because she got in. Oh, Kevin's on the bus. Oh, look, Kev's on the bus. What up, Kev? Hey, not today. I got a lot on my mind and I don't really need you throwing me off. I know who you are. I know who you are, sir. I know who you are. Just say thank you. Hey, thank you. Thank you. Okay, thank you. What special? I work in the operating room, so that's my specialty. I work in perioperative services. So I've worked in PACU and I've worked in the operating room as a circulator, as a circulating nurse. I also used to be a surgical tech, so I've been in the surgical realm for since 2010. So 13 years. So I have a good grasp of a couple of other things. I think most hospitals underestimate LPNs and it's crazy. The thing about it is like they're trying to funnel out LPNs because one, they don't want to pay them, and two, they're trying to force every nurse, LPN and 2-year or ADN nurse, they're trying to force them to the BSN level because when you force them to the BSN level, they get magnet status. The more BSN nurses that they have in a hospital, the more they can apply for magnet status, which means more money. It's a teaching hospital, so it's all about money. Hey, it's all about the bottom line. You hear me? All about the bottom line. What can one do if you want to switch from ICU from doing a sniff? What you mean? I don't know if I understood that. You're welcome, Kate. Oh, you want to go to the ICU from a sniff? Are you an LPN or LVN or RN or an RN? Let's see. Just started my last semester of LPN school. Shout out to you. Is it Diana? Oh, I appreciate the rose. Y'all are nice. I appreciate it. What's up, Jess the Miss? Girl, I see you out there. You know what I'm saying? What'd I say MAGA status? Make America get nurses again? No, I don't even think that's right. My bad. I just took the NCLEX today, finished at 150 questions, got the bad pop-up. Is there any hope? Yes, there is hope. So remember, the bad pop-up is not set in stone. The only thing that's set in stone is when you do the Pearson View or when you pay for your when you pay for your unofficial transcripts, and then you get and it says yes you passed or yes you failed, and when you get your nursing license. Speaking of nursing license, I should probably renew mine. I've got a lot of notifications. Hey, don't let that linger. You feel me? Don't let that linger at all. Yes, I do high risk OB. I'm planning to switch to peri-op soon. Love that for you. Straight up. Oh, RN. Is it exo Tish or kiss Tish? Kiss and hugs Tish? Girl, you know what I'm talking about. I'm just calling you Tish. If you want to go to the ICU, the biggest thing for you from coming from a sniff, you just apply and then they'll put you through the residency program if they have a residency program, or you can go through their residency program because it's something that's very, very new to you. You can just try that. Is it Art? Is it Arda? Arda. I'm going to call you Arda. Okay. So you feel discouraged because you're floating out there in the unknown because you don't know. Tippy, you ain't late. You just on time. So you're floating out there in the unknown. But Arda, here's one thing I'm going to tell you. If that's the worst thing that can happen to you, I think that's okay. You not doing well at that exam. For those, all 38 of you that are new here, or for anybody that's new here, I have failed my NCLEX 3 times. 3. This is just one of the 3. And I actually had this posted up on my I Love Me board because it's a constant reminder to where no one will ever know, no one will ever care. And no one will ever know because unless I open my mouth and I say something, and no one will ever care because it won't stop me from getting a job. No job will ever be like, hey, how many times you take the NCLEX? Never. All they care is that you have a license, which I do. No one will ever know. So you can feel discouraged. And I'm going to tell you the same thing that my mentor used to tell me, Art. You can feel discouraged, but I'm going to need for you not to feel, I'm going to need for you that I'm going to feel sorry for myself. I'm going to need for you to get rid of that real quick, because now I need to know, how are you going to pivot? If what happens to you that you're unsuccessful. So you can cry about it, but then I'm going to be like, what are you going to do to fix it? And then that's where I come in as a mentor here, where I love talking to people. I'm like, all right, cool. You failed. I'm sorry to hear that. What are you about to do about it? You going to sit there and cry about it? Or are we going to fix it? You let me know. But you got all the love and you got all the support down here in this chat with all these folks that are in here. Trust and believe me. Shout out to all 41, 42 of y'all that are up in here listening to me run my mouth in my nice little light blue, whatever this is. If you've never been here before, my name is Kevin. I go by the Boot Nurse on all social media platforms. I want you guys to check them out. Check me out on YouTube. Check me out on Instagram. Check me out on X. Check me out on Thread. Why they competing with, you know what, whatever, bro. Follow me over there. Hey, and I got 41 people in here, and I got 3 shares. I need at least 10. I need at least 1,000 likes. You want to know why? Because you love me. I need y'all to follow me. You want to know why? Because I'm trying to do NCLEX style questions on my computer. And I need 10,000 of y'all to love me and follow me. Because until that happens, I gotta rig it and sit right here and just be like, yeah, I gotta do all that. Y'all, I ain't trying to do all that. I get tired of sitting here. Your boy got a headache. Help your boy out. You know what I'm saying? I love y'all. I appreciate y'all. So if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Are you taking your NCLEX? Are you about to graduate? TikToker. There's some folks up in here I know that's finna graduate. You know what I'm saying? Like, where you at? Like, talk to me about it. Let us know down in the comments and, spark up a conversation with one another. Answer each other's questions. We're trying to foster a good environment for nursing. You know the one thing I hate is that nurses eat their young shit. I'm not about it. And if I ever see it around me, I'm gonna be like, bro, you talk to your mom like that? You know what I'm saying? We're supposed to take care of one another and teach one another, because at some point somebody is going to replace you. Period. And other people, you think about yourself and you think about now rather than think about what impact you could have on somebody right now that'll last 5, 10, 20, that'll outlast you. You know what I'm saying? Like, a lot of people are just like, man, my parents were great. Yeah, you had great parents that raised you for 18 to 20 years. And then when you're 40, you're going to be like, man, my dad was great. My mom was great. That's because they raised you right and they left a lasting impact. So why would you not leave a lasting impact on a new nurse if you're a seasoned nurse? You know what I'm saying? Most people are selfish. And that's the shit that I can't stand. And that might just be the military aspect of me. Oh, also, for those that don't know, I've been in the Navy for 16 years. I can get real abrasive sometimes. So at one time, I think I knife hand like the whole chat. I didn't mean to. I'm working on myself. You know what I'm saying? So I'm just letting y'all know. Sometimes I can get a little out of hand. And sometimes I got to reel me back in. But I appreciate y'all. But it's all out of love. You know what I'm saying? So I've been an instructor. I've been an educator for 8 years. I'm a master instructor in the Navy. I've taught a surgical technology program for 3.5 years, and I taught a whole bunch of other programs. And I love being here. I love teaching y'all. So I want to know who you are. And I got 20 messages to catch up on because I'm just talking to y'all. So my bad. Jennifer Hernandez says, struggling with deciding on whether to go LPN or RN. I'm a mom that will be doing it part-time. So Jennifer, the one thing I'll tell you is do what you feel is financially feasible for you, because I'm telling you, RNs aren't going nowhere. The schools, 2-year or 4-year. So if LPN is financially feasible for you to do that, then do that. That's okay. I know LPNs that make $100,000 a year. I'm just saying, I'm trying to tell y'all can make some money out here, yo. Y'all can make some money out here. Hospice, I failed. What you mean you failed, girl? What you talking about? Kylie said, I'm taking my NCLEX soon, but there are some medications I don't recognize. So, Kylie, the one thing I would tell you about pharmacology is no family name and suffixes. So if we start talking about calcium channel blockers, all calcium channel blockers in with, what are they, Prils or Dipines, right? Besides like verapamil and Cardizem, right? Or you could think about like beta blockers all end in LOLs. So beta blocker, labetalol. So I'm looking at heart rate. I'm looking at blood pressure because that's his main thing. Thinking about orthostatic hypotension. I'm thinking about safety, right? When do I not give it? So it's just like, it's all about recognizing what it is. When you get the last part of that medication, that's when you're just like, okay, that's an LOL. Okay, that's a beta blocker. What does a beta blocker do? What is it for? Oh, it's a cardiac med. Oh, what does it do? It lowers my blood pressure. Oh, okay. When should I give it? When should I not give it? Right? What does it do? What's my potassium going to look like? What are my other, that's how you fought. The NCLEX wants to know your critical thinking and your clinical judgment. That's what it wants. And by that, it's just like following. It's like, what do the trends look like? Are we going up? Are we going down? Okay, I did this. What should I expect? What do I do if I don't, what do I do if something is unexpected? That's what you need to do, okay? It was my second time I used NCLEX High Yield in UWorld. Okay, Arda, so the one thing I'll say, I don't know what else to do. Okay, so I'm going to ask you this, Arda. What's your time management look like? So time management is life management. Think about that. 32 of y'all, time management is life management. I actually said this to another group of my peers. We were talking about what are some things that we learned. I learned that time management is life management. It's not just about your time, but it's about your life, right? Do you understand NCLEX style questions? Do you understand content? Do you have a content deficit, right? Do you have a support system? I'm not saying that you have to have one, but it's good to have one. And if you don't, now you got one. You see what I'm saying? Let's see. Did you recreate the testing center? Do you have test anxiety? Did you figure out how to beat that test anxiety? It's not. So when I say pass the NCLEX, I don't even like saying that. I say conquer the NCLEX because it's a journey. You need to you start from the beginning and you work your way all the way through. And it could take you anywhere from a year to 4 years to 5 years to get an RN or an LPN, right? Everybody's journey is relatively the same, but different, right? So how is your journey? What is it that's going on? What are the environmental factors, right? So they are statistically proven with UWorld and NCLEX High Yield and other programs that are out there that they work. But how do you apply them? You see what I'm saying? Have you ever thought about starting a business as a nurse? Yanni, ma'am, check out the 7-day NCLEX course. And I also do NCLEX coaching and mentoring on the side. I do one-on-ones right now, but I'm also working on doing group coaching. I'm going to start with 5, and then I'm eventually going to work to 10. That is in the process. I get asked all the time about one-on-ones. So if anybody wants to know about doing a one-on-one, they're currently in there. Go to thebootnurse.com, and then when you go to thebootnurse.com, click on NCLEX Coaching and Mentoring, and it has the page there for you. And so, yes, I've been a business owner, or I've had a business for the last 3 years doing coaching and mentoring, as well as just now starting the 7-day NCLEX course. Sorry if you guys hear my co-host, it's my son, because obviously he doesn't know how to act, right? So let me see what else you guys are talking about. You came across my For You page, Go Horns. Hey, shout out, Go Horns, Jess. You're the other Jess the Mess. But, I don't know if you want me to call you that. I'll call you Jess, Jesse, Messy Jesse. I don't know. You know what I'm talking about. Our level 1 hospitals still requiring BSNs. So most hospitals, what's up, Megan? Most hospitals, that's what they want. But sometimes beggars can't be choosers. I'm just keeping it real. But if you get hired there as an LPN or you get hired there as a 2-year RN, they're going to be like, hey, when do you plan on going to school? They'll put a stipulation on you. They'll be like, okay, you can start, but within 5 years, you need to be getting your BSN. That's what they're going to start doing. Or that's what they have been doing. I'm sorry. Just a mess. I don't know what you said OMG for. I got a lot to catch up on. Shout out to all 41 that of y'all that are up in here. I want to know who you are, where you're from, where you're at in your nursing journey. Is dealing a good standing? What is a good standing point for a nursing grad? What is DOU? I don't even know what that is. Department of Understanding. I don't know what that is. In level 3, I left in clinicals in tears because of my preceptor. I promise to never do that to myself. Facts. I see what you're talking about now. Like, don't be that way. Rue RN says St. Louis, BSN in 2004, ER trauma, urban, level 1. Shout out to all those level 1 traumas. Hey, that's another thing too. All my brand new nurses, I wish I would have listened. But hindsight's 2020. When you graduate, go to a level 1 trauma facility. Go to a level 1 trauma facility because you have everyone and everything that you could ever need while you're there. And I know I might be saying this lightly for people that are at a level 1, but I work at a level 3. And let me tell you, working in the ICU at a level 3 was a headache. I don't believe going there and working as a student. I believe that everybody should go to a level 1. And then if you go to a level 3, you should go to their work. You shouldn't go there to learn because I feel like the learning is not conducive. That's me. That's my opinion. I don't speak on nobody else, but me, based off my experience. And it was trash. So I'm just saying, I'm just letting you know, over half done with nursing school. I have a failure under my belt, but it ain't stopping me. That's right. You want to know why? Because when you start working, ain't nobody going to ask, hey, how many did you fail? Jonah, how many did you fail? Nobody care. I failed my first NCLEX. Hey, look, I failed it 3 times. I'm just saying. So I love behavioral health, but I'm torn into going that way versus med surg for experience. Keisha, you can go either one. I feel like as soon to be LPN, my license will be utilized more on med surg. Actually, your license can be utilized both. Hey, so Nurse Nelly, Nurse Nelly is here, y'all. I didn't even know that. I'm sorry. Shout out to my co-host, Nurse Nelly. You see what I'm saying? Been a nurse for 4 years, med surg, tele, ICU, now doing case management, loving her life. Loving her schedule, still doing her nursing thing, but now her mental health is way a lot higher through the roof than when we were nursing students and when she worked at a hospital. So she's my co-host. If I don't get to your question, she'll get to your question. And by the way, for all those that are new, you go, hey, you act stupid in my chat, you're getting to 600. And she will 600 you before I do it. I'm just letting you know. So don't act a fool up in there. I'm just letting y'all know. I think I recognize you. Are you in Texas? Keisha. Yes, I am in Texas. Kevin, I had the worst day at clinicals today. Calliope, tell us about it. I had the worst day at work today. I ain't telling y'all about it, but Calliope, let us know. Nelly, you had a good day today? That's what I'm talking about. Glam says, can you post your website address, please? So Glamjoy, my website address is in the, Nelly, post it for me. Nelly will post it for me. Is it Sune? Hey, Rue says, I love every minute of level 1. I loved it as my starting point. That's what I'm trying to say. I wish I would have did that, but I didn't. So what up? I'm thinking about applying for an LPN program at my community college. Do it. Instead of thinking about it, do it. Like, don't talk about it, be about it. You see what I'm saying? Like, so I like to pull the Yoda thing, like do or do not. There is no try. You know what I'm saying? We had a meeting and they talked about how I'm management material. Facts. You were great. I'm out. But I would take your class if I needed anything. Hey, I appreciate that, Rue. I really, really do. I really appreciate that. My preceptor literally stole an opportunity from me to do my first blood draw. Calliope, you're gonna have so many other blood draws. Don't let the things that are out of your control. Don't let the things that are out of your control, define on how you're gonna make your next move. Okay. You trust me. Trust and believe me when I tell you, you're going to have plenty of blood draws, and then you're going to get to the point where you're going to start teaching people, and then you're going to be like, hey, I ain't drawing nobody's blood. You see what I'm saying? So don't even beat yourself up. Don't even beat yourself up. All right. So shout out to all 34 of y'all. If y'all are new here, first of all, we got 34 people in here. I only got 5 shares, and I got 1,000 likes. I'm going to need for y'all to love me a little bit more, okay? All right. Love me a little bit more. Go Horns. You see what I'm saying? Love me some more, okay? I need 10. TikTok apparently don't like me. I need 10,000 people, bro. I need 10,000 people so I can stream from my computer. I thought it was 3,000. The moment I hit 3,000, it's just like, not. You know what I'm saying? I need 10,000 people to love me and follow me. All right. And share as much as possible because you know what we're trying to do over here. We're trying to build that community. Also, anybody interested, you can join my Facebook group. It's the Boot Nation. Check it out. It's for nurses, nursing students, and pre-nursing students alike, for everybody, from the beginning of your journey all the way through your nursing journey. We're trying to foster a good environment over there, so make sure you guys go over there and check that out. All right, so like I said, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, and what questions do you have about anything, all right? And we're going to check out some nursing news right now. I don't think I see a lot of stuff popped up versus from what I said the other day. I think we talked about nurse practitioners. It's growing. There's a nursing ratio, a staff ratio that's going on in Oregon to where they're trying to hone that in, like, two patients per ICU nurse, 4 per med surge, all that good stuff. Did you guys hear about in New York City that they're going to have 2 nurses per 1 critical care patient? Look, okay. I hate when teachers do that. I'm just saying. Very true. I was just upset because I was excited to do it for the first time, but my teacher stole it. You know what? It's okay. Don't even sweat that. And then I heard another thing where they were talking about they fired like 100 plus urgent care, or they fired like 100 nurses from like Med Express urgent cares. I don't know anything about that. I didn't read it or anything like that, but it's definitely something worth looking at. If anybody has any questions about it, I get all my nursing news from nurse.org. So if you want to know anything about it, check them out. I'm also trying to be on that podcast. Maybe y'all can like dip in there and be like, yo, get this dude on your stuff. You know what I'm saying? But y'all already know it's all love. So that's the nursing news. Pay attention. The Rona's going up. So, pay attention on how that's moving right now. Okay. So y'all want some NCLEX style questions? I know y'all do. Hey, if y'all want NCLEX style questions, you better tell me that you love me. And the only way to tell me that you love me is the like button, the share button, and following me. I'm just saying. So I did do a little bit of research, and I was kind of messing around, and I was like, man, where can I find some really good questions? What is it? Nurse Lab. Nurse Lab? Yeah, nurselab.com, right? And what is a Nurse Lab? It was Nurse Labs. Nurselabs.com. They have, NCLEX style questions. I don't know how great they are, but I kind of looked at them. But then again, it still would be kind of good because now you can kind of sift through them and just get a better understanding. I have shit signal. I had to run to HEB for some stuff for dinner. That no worries. Just the mess says Calliope. I have precepted a lot of new grads. Don't give up. Show her you're eager. Yep, that's all you got to do is be like, look. I really want to do it, sir or ma'am or whatever you identify as. I'm just saying. Just let them know. Let them know what you're trying to do. And I'm trying to find this damn. Y'all hear him? Y'all hear him over there? He don't know how to act. I'm trying to tell you. Here we go. I think I found it. So somebody specifically asked me. They have care plans. They do have care plans. Hey, Kevin, I'm sorry my phone died. Can you tell me your website again, please? Again. Nelly, can you put it in the chat? So it's thebootnurse.com. That's the website. Now, if you want, thebootnurse.com. That's the website. If you want a direct link to the 7-day NCLEX course, which is going for $48, 80% off of the current price. If you're looking for that, and we're in the pre-launch phase, so we're growing for $48. If you're looking for that, that link is in my bio on TikTok. Okay. So I do believe that somebody specifically asked for pediatric questions. I do remember that. So what I think I'm going to do is I'm going to look for those pediatric questions right now. And I think we'll just do that. We'll just do it together. What y'all think? Don't know it was you. You asked for peds. Okay. Thanks for Hey, see, look, I got you. That's what I'm talking about. I got you. So let me look. Let me see what we got. That ain't what I want. Close. Let's see. Oh, okay. I think we got one right here. Yo, we could do this. All right, cool. So here's the thing. We're going to do NCLEX style questions. It says, good God, it wasn't me. Thunder, I know it wasn't you. I knew it was somebody, but I knew it wasn't you. Any GAD exchange question? Oh, gas exchange questions. So we're going to do peds, and there may be some gas exchange questions in there. I'm just pulling this straight from nurselabs.com. And because I was kind of messing around looking on there yesterday. But I was like, you know what? Let me see. And I was like, let me see if they have peds. Because I remember somebody was asking me about peds. And sure enough, here it is right here. So this is what I'm going to do. We're going to go through it together. I've never seen these questions. We're going to go through them together, right? But y'all are going to answer them. And then we're going to go through them together. The reason being is because we can actually break them down together. And as we break them down together, you have a better understanding of what's happening. And you have a better understanding of the questions that you're looking at. All right. So I got it up right here. There's 50 questions. I can tell you right now, we ain't going through 50 questions. We'll probably get through maybe 15. All right. Maybe 15. So y'all give me a sec. Let me get my life together. Right. So excuse me. Oh, I love it. right now, like, what the hell is singing? Anyways, all right, here we go. So, let's see what's going on. All right, there we go. There we go. There we go. Y'all see my I love me board? Hey, perseverance. Y'all see it? Perseverance. And that's my son when he was like 2 weeks old, right? And then, leader. So you want to persevere. You always want to be a leader. All right, so here we go. Let me get this. Good to go. Good to go. What you mean stop singing? First of all, I get called Jason Derulo all the time. So when I start singing, now I'm wrong? What you mean? You have military background? I do. I've been in the Navy for next month. It'll be 16 years. I know you can never tell with the glorious melanin that I got going on here, right? You know what I'm saying? Black don't crack, baby. So here we go. Let's. Hey, I'm just saying, I love being here. So here we're about to do this right now. All right. I don't know why this is so bright. All right, cool. Now, can everybody see that? Can everybody see that? I feel like it might be too bright. Can everybody see that? No, you can't see it? Here, let me see something. That better? No, that ain't better. It's too bright. All right, look, I'm trying to work my life out, all right? Trying to get it together. Let me see. Let's see. Here we go. Let's do this. Ew. Nope, that ain't working. Let's do that. Nope. Wait, that helps. Oh, what when it was orange? Let's see. Is that better or is that too bright? Yeah, orange? Okay, let's see. How's that? I know. Hey, y'all are rocking with me. I'm just saying, y'all are rocking with me. Yeah? Orange is good? Orange is good? Yes? Much better? All right, cool. Sweet. As a matter of fact, yeah. All right, cool. Who is that, Jacqueline? Your name is now Jaqueline, even though you don't got a Q in your name. So I ain't ever seen you before. I need some likes, and I need some loves, and I need some shares. I need 10,000 people to tell me that they love me. And by that, I mean sharing my stuff and following me. I'm just playing Jack. Can I call you Jackie? Stace? Jackie and Stace. All right, that's what I'm talking about. All right, here we go. Hey, so we're going to do these questions, but we're going to do them together. But I'm only going to answer them based off of what y'all say. Hey, Ron. Yes, that's exactly what we're doing right now. All right. So the first question says Molly with suspected rheumatic fever is admitted to the pediatric unit. When obtaining the child's history, the nurse considers which information to be the most important. The most important. All right. Our answers are a fever that started 3 days ago, lack of interest in food, a recent episode of pharyngitis, or vomiting for 2 days. What we got? And make sure you guys share this. This is the part that people like the most, is the NCLEX style questions. I'm just letting y'all know. Jessica Mess says D. Okay. All right. Sandy says D. Christina says D. Okay. All right. What else we got? Ollie says C. Okay. What else we got? Glam says D. Vomiting for 2 days. Okay. Okay. Right. Options again. So the options are, can you not see him, Thunder? Jonah says C. Okay. Calliope says C. Right. TikToker says A. Okay. Ollie says C. Man, y'all are all over the place. All right. What do we got? Let's see. Man, I really don't know why this is so bright. This is actually kind of bothering me now. Stacy says C. Okay. User 50 says C. Let's see what we got. All right. All right, cool. So C. You got C, C, A, A. I think we're all over the place. So I think the general consensus, I think it was C. A lot of people said C. A lot of people said D. I saw more C's than D. So we're going to go with C. All right. So he says, I'm thinking of strep. Okay. Right. So let's think about this. It's like the suspected of rheumatic fever, right? Admitted to the pediatric unit when when obtaining the child's history, the nurse considers which information to be the most important, right? So remember, if we start to think about like our ABCs, right? That's another thing to consider, right? Do we assess or do we implement anything? We don't need to implement anything, so we need to get more information. So we're going to assess, right? And then we got to think about what is physical or psychosocial, right? Strep is a risk for rheumatic fever, right? So everybody's saying C, right? Because pharyngitis is a what? What is that? What is it? What is it? What is it? Me. Pick me. Throat, right? Bacterial, okay. What else we got? Shout out to all 28 of y'all. Inflammation of the throat, okay. Okay, viral infection, okay. All right, so so I'm assuming the general consensus is C, so I'm going to pick C. All right, here we go. If it lets me work. Okay, here we go. So C, and the answer is C. Look at that. A recent episode of pharyngitis is the most important factor in establishing the diagnosis of rheumatic fever. Activation of the innate immune system begins with a pharyngeal infection that leads to the presentation of pyogene antigens to T and B cells. So CD4 plus T cells are activated in production of blah, 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 blah. Cool, right? But then also, an infection of the throat, what is that? What's another issue is that? What other issue could we be thinking about? It's also recent. Correct, it is also recent. Well, let's go. Let's go. I said strep throat. That's what I'm talking about. All right. How y'all feel about that? Y'all feel all right? I'm sorry. I wish I could actually make this a little bit better, but this is what I get for, having issues with me today, right? Yeah, breathing, right? Pharyngitis, inflammation of the pharynx or the phalanx. No, the phalanx is a line that the Spartans do. Anyway, it doesn't matter. So here we go. On to the next one. All right, here we go. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is intense abdominal cramping, profuse diarrhea, anal fissures, or abdominal distension. What do we got? Somebody give me a heart with a crown. Shout out to you. Is it Mr. Nurse KC? I appreciate you. Thanks so much. What we got? What y'all thinking? Let me see if I can bring this a little bit closer. Get this thing out of the way. I'm going to bring this a little bit closer. Okay, maybe that didn't help at all, and it did not. All right, what we got? What y'all thinking? What do we got? What are you guys thinking? The nurse is aware that the most common assessment finding in a child with ulcerative colitis. What is ulcerative colitis? Like what part of the body is that in, right? What is the most common assessment finding in a child with ulcerative colitis? Is it intense abdominal cramping? Is it profuse diarrhea? Is it anal fissures, or is it abdominal distension? Intestines, A. Glam says A. Gastrointestinal. Calliope says A. Is it Tylette? It says gastrointestinal. Okay. All right. What else? What else y'all thinking? Just the mess says B. I know you can't read it. I'm trying, Nelly, I'm trying to fix the screen. I wasn't prepared to do this right now. So let me see something right now. You know what? Maybe I'm gonna mess with the effects right now, because that might be the issue too. But go ahead, keep answering, y'all. Keep answering. Let's see what's going on. It's time for lunch. Don't mind me. It's gonna be a tummy issue. Grandma Nelly over here. It's all good. You got Grandpa Kevin over here because obviously he can't get his life together. Fixing the stuff that all the kids like, aka the Tic Tac. Let me see what's going on. Effects. Nope. That ain't what I'm trying to do. Nope. Man. Background. All right, y'all. I'm trying to figure it out. It's not working. All right. Ali says, I'm not sure. I'll read it again. I'll read it one more time. Okay, Sandy says she's going to guess A. Okay, cool. It says the nurse is aware that the most common assessment finding in a child with ulcerative colitis is intense abdominal cramping, profuse diarrhea, anal fissures, or abdominal distension. I'm stumped on this one, but I feel like it's D, swelling of the colon. Okay. Could be. Could be. Could be. All right. I'm guessing, but distension. Okay, so that would be D. Fired? Oh, man. I know I'm fired. I'm trying to get my life together. But a lot of people said A. I had some B's. But it looks like I've seen more A's than I've seen B's. It's probably A. They will have diarrhea usually with blood. Rose says D. Okay. A or B? Ma'am. Mess of Jess. You gotta pick one. Thunder says, I'm thinking A. Okay. Hey, remember, do or do not. There is no try. Which one? So it looks like we're gonna go with A. Ma'am, don't roll your eyes at me. I'm just being honest. Okay. It ain't my fault they're trying to pick both and the only one is the right answer. I'm just saying. Shout out to all 28 of y'all listening to me run my mouth. Because, I'm the dude behind the camera. Because, if you just came in here, you obviously haven't seen my face. I look like Jason Derulo. You better ask somebody. No, I'm just playing. But, well, probably not. But anyways, so welcome to the live stream, bro. That is why I take care of geriatrics, right? Look, hey, shout out to all y'all that love taking care of babies. I'm just saying. It's hard because they could have all, but I'm thinking A because cramp might come first. Remember, what is the most important? What is the most common thing that you would see, right? And it looks like A. I don't do kids at all, right? I don't blame you. If it looks like it's A, I think I'm going to go with A. We'll stick with A. And the answer is 3, 2. Oh, it was B. So we'll read the answer and then we'll look at option A. It says the most common assessment finding in a child with ulcerative colitis is profuse diarrhea. The main symptom of ulcerative colitis, just like somebody said, is bloody diarrhea with or without mucus. Other symptoms include blood in the toilet, on toilet paper, or in stool. Characteristically, it involves inflammation restricted to the mucosa and submucosa of the colon. Typically, the disease starts in the rectum and extends proximally in a continuous manner. Now, for A, for those who did pick A, ulcerative colitis does cause intense abdominal cramps. Associated symptoms include urgency, abdominal pain, malice, weight loss, and fever, depending on the extent and severity of the disease. The onset of the disease is typically gradual, and patients will likely experience periods of spontaneous remission and subsequent relapses. But the biggest thing is what is the most common? Not saying that, abdominal cramps doesn't come with it, but what's the most common? Talking about profuse diarrhea, because that's going to cause an electrolyte imbalance and also could cause you to have a dehydration issue, which will then get to a circulatory issue, so on and so forth. Can you talk about the wording of the answer, intense versus profuse? So I'm glad you brought that up. So in regards to profuse is think of it's like continuous, and remember it comes with bloody diarrhea, right? So essentially they could just be, because diarrhea is it's constant, right? It's continuous. Sometimes it happens, sometimes you'll sit on the toilet, get up, and then the moment you get up, you got to get back on it, right? So it's just shooting out of you. It's kind of like if somebody had a blown off extremity from the femoral artery, you're going to profusely bleed. You're going to profusely hemorrhage. So when you see profuse, that would be the key word for that. Give me an 18 to 45, right? Give you 1845. I'm just saying you think that'd be easier. But who answered me that? Jonah, did I answer your question? Always go with the first guess, Jess. That's what I'm saying. Ma'am, get it together. Get it together. Yep, it's gotcha. So profuse is more medical jargon than it is just a distraction word for answering anyway. Correct. So it is, but it is a very hey, this is happening right now type of word, right? So you got to know the difference between here's the thing, what if you saw somebody that was oozing blood versus profusely bleeding? Which one would you go? Or if you saw somebody that said profusely bleeding versus just bleeding. So yeah, you can have those distractor words, 100%. Profusely, exactly. Profusely. I understand. That makes sense. Thanks. Yeah, no problem. All right, cool. I think we're good with this one. And we'll go on to the next one. All right, cool. Like I said, sorry, guys. I know this lighting is terrible. But next time I do NCLEX style questions, I'll make sure to get them on a PowerPoint so everybody can read them. And, that way I'm not slow. Shout out to all 33 of y'all in here. Welcome. If you guys are new, we're doing NCLEX style questions. And, I want to know everything about y'all. Let us know where you're at in your nursing journey. We got a bunch of people that are in here learning just like you if you are new here. So I want to know who you are, where you're from, where you're at in your nursing journey. Let us know. Let us know. Let us know. All right, cool. Now on to question number 3. It says, when developing a plan of care for a hospitalized child, Nurse Mary knows that the child in which age group is most likely to view illness as a punishment or a misdeed. Is it A, infancy? Is it B, preschoolers? Is it C, school age? Or is it D, adolescence? What are we thinking? What are we thinking? Jonah says C. Okay. Mr. Nurse KC says C. Somebody said B. Who said B? Hospice said B. You should also say what you think the answer is right before you show it to us. Calliope, this ain't for me. This is for y'all. But I'm doing it for y'all and for me. But if you want me to give you my answer, I will. I'll do that. Thunder says D. Marlo, never seen you before. Welcome. Tylette, the B. Zach says B. Tiffany says B. Stacy says C. Mr. Nurse KC says B or C. Sir, you can only pick one. What is preschool age again? I think it's like, if I remember, I think it's like 5 to 4 to 6. And school age, I believe, is like 6 to 11 or 12. Yeah, preschool is 4. Yeah, that's what I thought. It said, I know, but I just want to see what you think since you're seeing these for the first time with us. Okay, I got you. Stella says C. I'm going to go with C. It says ends. Is it ends? You say C. So, okay, you say C. You have some people say B. All right. Let's see. What else we got? All right, cool. All right, Calliope says B. Okay, school age. Okay. Let's see. What else? I think we all got a general, I think everybody gets a general consensus. I think C, but Jack is 6, and I feel like he would think it was a punishment thing. Yeah? I mean, that's the thing, and that's a great thing. It's like, for those that have kids, you can use your children as a reference. You'll be like, man, I have a 4-year-old. Like, what do they think? Like, what do I think? Like, what do they think? Like, you got to think of, like, where their mindset is. And think about how you communicate with them as well. I have a lot of kids. Yes, we know. You have an army over there. We got you. We got an army of children's over there. Sarah says C. Nelly laughs. All right, cool. So, okay, Rose says C. So I think we're between B and C. We're between B and C. But I saw one D. I think I see a bunch of C's, but I also see a bunch of B's. But I think B is the general answer. I think B is the general answer. I think we'll go with B. We'll go with B. All right. We'll go with B since B is the general consensus, right? Isn't school age the magical thinking? Yeah. Yes, it is. The magical thinking stage. Yup. All right. So we're going to go with B because more people answered B than C, right? So I'm going to answer B. In 3, 2, and the answer was B. Shout out to everybody that picked B. I'm thinking for operational period. Yep. So shout out to everybody that got B. Woo. Hey, shout out to you, Calliope. All right, cool. Got you. Preschool age children are more likely to view illness as a punishment for misdeeds. When children in this age group become seriously ill, they may think it's punishment for something that they did or thought about. They don't understand how their parents could not have protected them from the illness. Now, for the other one, we'll say C. It says fear of the unknown, loss of control, and separation from family and friends could be the school-age child's main source of anxiety and fear related to death. They may fear their own death because of the uncertainty of what happens to them after they die. So, and I think somebody else picked D, where it says the fear of death is typical in adolescence. So think about it when you're like, what is it, like 11, 12 to 17 for your adolescence, right? So you got to think about, like, they want to be independent. They want to hang out with their friends. I got you. And, the main theme of teens is, they feel immortal or being exempt from death, right? So especially if you have boys, right? Anybody that has boys, when they hit that age, they'll be like, I could do whatever I want. I can surf on top of a car. until they fall off a car and they end up in ICU and they're just like, bro, how did I get here? I'm just saying. Yeah, you put D, yikes, it's okay. That's why this is here. You learn from those mistakes. This is why it's so important. Like, look, I got the answer wrong. I picked C. I have no shame in telling y'all that I picked C either. At all. Oh my God, that's my boy. Look, see, Sandy, look. You better like punch him in the throat or something and be like, hey, you better not be surfing on cars. What the hell you think this is? No, but look, I got the answer wrong. And so this is just one of those things where you learn from why you got this answer wrong. Okay? So, and that's why it's so important that you read the correct answer, but you also read why the answer is incorrect. Yeah, you do have kids. You have kids in all those stages. So, all right. Good job, everybody. Hey, and if you didn't get it wrong, if you didn't get it right, that's okay. Don't worry about it. Brush it off and go on to the next one. All right, here we go. We don't ever want you to hold on to anything, because if you hold on to something, you're going to be like, bro, like, I'm never going to be great. Like, stop it with the nonsense. All right. Rationales are key. Marlowe. Can I call you Jack Marlowe? I'm sorry. I couldn't help myself. Anyway, shout out to all 26 of y'all. But Marlowe is right. Rationales are the key. Content, Q&A, and reviewing. That is what you want to do. Okay. So question number 4, a female child age 6 is brought to the healthcare clinic for a routine checkup. Okay. So paint the picture for yourself, right? To assess the child's vision, the nurse should ask what? Remember, we're dealing with a 6-year-old. Remember, we just got finished talking about, we're school-age kids, so on and so forth, right? So, hey, do you have any problems seeing different colors? Think about asking a 6-year-old that, right? Do you have any trouble seeing at night? Okay. Do you have problems with glares? How are you doing in school? Right? Think about that. Think about a 6-year-old. Right? Think about what you would ask them if you had a 6-year-old. Okay. So what do y'all think? I need answers. I need answers right now. You know what? And I'll give my answer right now. I would say A. I would think A. I would think A. Calliope says D. Tiffany says D. Nelly says none of the above. Well, E is not an answer, ma'am. Okay. All right. Mm-hmm. So, yeah. Mr. KC says A. Stella says D. Tylette says D. Thunder says seeing colors. Okay, so you say A. A is an assessment for color blindness. Possibly, but remember, you got to think it's a checkup. So yeah, I might want to know about color blindness, right? Probably colors though. Yeah, because that's a pretty direct question that I would ask, that I could ask a 6-year-old, right? Be like, what color is this? Or, you can ask the overall question. It's just like, hey, how are you doing here? Right? Because you got to think there's so many answers, right? But you already know there's not going to, when it comes to multiple choice questions, there are going to be 2 that are wrong, just completely wrong. Then there's going to be one that's right and then one that's more right, right? The first 3 answers have to do with eyes. I choose A. Okay, Sandy, I got you. Thunder says, I have a 6-year-old and I don't ask her jack. Look, you might want to ask her. Be like, hey, yo, what color do you see? And they're going to be like, purple? Be like, first of all, this is orange. I'm going to need for you to go stand in the corner. No. Oh, Zach says, how often do you do NCLEX style questions live? So this would be day, 3 that I've started doing NCLEX questions live. I noticed that everybody loved them. I actually got multiple messages and I actually got multiple requests in the chat asking me to do NCLEX style questions. And I'm just like, you know what? Why not? And so I started doing it. Everybody loves them, and I'll keep doing them until nobody tells me that, until they get tired of them. They're going to be like, hey, stop talking about NCLEX style questions and go away. Guy, Rochelle says D. Marlo says this one's a toughie, but you're going to go with A. JD says D. Rochelle says the other 3 don't make sense to me. Okay. Nelly says A. Is it Little Shy Baby 38 says D. Rochelle says, but with D, you can find out a lot, but vision is key for seeing and participating. Okay. Okay. I like where your head is at. All right. So it looks like we have a lot of D. We have a lot of D. I've seen more D's than I see A's on here. So it looks like D is the general consensus. Okay. So I'll read the question again. It says a female child, age 6, is brought to the healthcare clinic for a routine checkup. To assess the child's vision, the nurse should ask what? Do you have any problem seeing colors or seeing different colors? Do you have trouble seeing at night? Do you have a problem with glare? How are you doing in school? And I'm reiterating this. I'm not trying to tell you to change the answer, but I like to ask, I'll reiterate. I just want to make sure we're all on the same page. Okay. It says D, definitely A. Okay. Oh, my bad. Okay, Thunder, you got it. Definitely A. You have me second guessing now after look, ends. I can't make you do nothing. You hear me? That's your brain, not mine. Yours. You hear me? Yours. All right. And I don't know, but doing that finger thing is hilarious. I'm just saying. So, hey, if y'all get the finger, whoever get the finger today, your sole responsibility is to make sure I get 1,000 likes. So, ends, your turn. 1,000 likes. Make it happen right now. A through C doesn't give room to open communication, whereas D can allow for more communication. Okay. Assessing vision got to me the second time, and I love the finger. Hey, look, I'm just going to make that a staple. Actually, D is an open-ended question, so maybe that's the best. Okay. All right. I just have the same thought as a person above. Like, look, and that's fair. This is why we I ask these questions. This is why I reiterate, like, what do you guys think? And you guys don't even know. I might be answering these questions on purpose. I'm just saying, I was just told to answer the question, and that's what I did. So, and no, you better not ask me to give you the right answer. I'm just going to answer it because I want to see where y'all's thought process is. And that way we can elaborate together. FYI, this is what I do in my one-on-ones. I'm just letting y'all know. This is what I do in my one-on-ones all the time. All right. Shout out to all 34 of y'all hanging out with me. Shout out to everybody that's new. If you are new here, welcome. My name is Kevin. We're going over NCLEX style questions. You got any questions about nursing, NCLEX, ask me anything within reason. Because if you get nosy, I'm going to give you a 600. I'm just letting you know. I'm just playing. I'm not going to give you a 600, but I just won't answer your question. I want to know who you are, where you're at in your nursing journey. Are you talking about NCLEX? Are you a brand new nursing student? Are you a nurse that's been a nurse for a while? Like, let us know. All right. And make sure you guys make sure you guys share this, and make sure you guys follow me. I need 10. Hey, if I can get 10,000 people to follow me on TikTok, I can stream from my computer so that way y'all don't see this nastiness that's going on right here. I'm just saying. Okay, Matthew, welcome to the club, sir, because we were just talking about that. But no, it's hard to, I'm reading the questions as well. I hear you, Matthew. I'm picking up what you're putting down. Call says, I take my NCLEX next Friday. Shout out to you, Call. I can't see the screen clearly. Trust me. I'm looking right at it and I can't see it either. I'm just letting you know. But hey, we making it work. We making it work out here. Okay. So I think everybody is saying, so what are we doing? Are we doing A or are we doing D? Which one? I need a consensus right now. Next 15 seconds. I need an answer. I need an answer right now. For all those. Okay. Hospice says A. Rochelle says D. All right, cool. A. That's 2 A's. 2 A's. I've been an LPN since 2009, back in school to go be an RN. That's what I'm talking about, Angel. So we got 3 D's. 3D. I'm not changing my answer, so I'm going with A. So that's 3. That's 4 A's. Okay. My answer is B. Okay, B. Got 1 B. Got another A. That's 5 A's. Nelly, I changed my answer. And you better get it together. We got another A. Looks like A is winning. All right, that's 4 D's. All right, looks like A is the winner. A is the winner. Sorry. A is the winner. Look, I'm just saying. Rochelle, I already seen your answer. I'm not arguing with y'all no more. All right, we're going on A. Rochelle, you can't put it 3 times. Hey, I'm answering this question. Here we go. We're going with A because A was the most. All right, so here we go. Here, A is. Oh, it was D. Look at that. Hey, look, there was this many A's and like this many like D's. All right, so everybody that picked D got the right answer. Ends. Look, see, shouldn't have changed your answer. All right, you shouldn't have changed your answer. A child's poor progress in school may indicate a visual disturbance. Most children do not have 20/20 vision until after 6 years of age. But at any age, visual acuity should be approximately equal between the eyes. The multi-ethnic pediatric eye disease study provides updated norms for visual acuity in children 2.5 to 6 years of age. So D was the correct answer. ATI will be the death of me. First of all, I don't even take ATI, and I know it would be the death of me. What you mean, Sandy? What you mean? That makes sense. It does make sense. I only knew that because I had a question like that in school. Look, and you know what? You'll never forget it, Tylette, ever. You'll never forget it. Now, let's see why A is not the right answer. It says this option is more appropriate to ask when assessing vision in a geriatric patient. The American Academy of Ophthalmology. There we go. I always mess that up. Wow. What the world? Did that just get really orange on me? That just got really orange on me. I don't even know what happened. What does it say? So it's for geriatrics, recommended to use the chart every 3 years. They talk about the Allen's test, so on and so forth, the Allen's test, so on and so forth. So the answer is D. That's what we got. Shout out to all 39 of y'all in here. Shout out to the 5,000 likes y'all just gave me too. If y'all love me, make sure y'all share, make sure y'all follow me, because mostly it's just because you love me. You know what I'm saying? I'm just saying. I took my NCLEX in 98 and it's showing. First of all, but you've been a nurse for a long time. So I would not expect for you to be all up in here learning all this. I've asked nurses that I've worked with, I'll ask them NCLEX style questions and they don't know because they either ain't worked in bedside for a long time or they're just like, they're thinking about other things. And that's okay too. Ain't nothing wrong with that at all. So are we ready for another question? Hey, there's some folks that are missing on this live and I'm a little sad. I'm a little sad that they're missing. I'm going to need for y'all to find them. If y'all know who I'm talking about, I'm going to need for y'all to find them, drag them over here, and tell them to get this knowledge. Stop playing games. I don't know if y'all heard my son. He is wild over there. I don't know what it is. Is this Peds? Ends. Yes, this is Peds. And if you want to blame somebody, it's Jonah's fault. It wasn't my choice. It's Jonah's fault. I'm just keeping it all the way 100 because Jonah asked for it. I'm just saying. I'm just trying to be a good host. She's like shaking my head. Oh my God. Well, apparently Rochelle's already answering because I ain't even asked the question yet and I ain't even read it. So I know she can read it. Here we go. Hannah, age 12, is 7 months pregnant. Yo, did y'all look? Y'all see that? Hey, anybody that go and work in labor and delivery, I can tell you right now, you're going to see it. You're going to see it and you're going to be like, yo, what the hell is happening here? Right? So you need extra time? Okay, I got you. When teaching parenting skills to an adolescent, the nurse knows that which teaching strategy is least effective. Least effective, aka what teaching method will not work for this adolescent patient. Okay, so first answer choice is providing a one-on-one demonstration and requesting a return demonstration using a live infant model. Is that least effective? Or is it B, initiating a teenage parent support group with first and second time mothers? Is that least effective? Or is it C, using audio-visual aids that show demonstrations of feelings and skills? Is that least effective? Or is it providing age-appropriate reading material? Is that least effective? When you read these questions, especially for the ones that you don't understand, that's how you want to read them. That's how you want to read them so you can better comprehend. Sometimes it's easier for you to put it in, you know how they say we don't use medical terms with patients because they don't understand our jargon? Do the same for yourself. There might be some stuff you don't understand. Trust me. Look, I wish you could hear me say like the generic name for a lot of these meds in pharmacology. It's actually hilarious. I actually get really upset with myself. I'm just saying. Everybody's saying D. Everybody's saying D. I think I saw somebody in here who said C. Because C's get degrees. I think. So I've been told. All right, what else we got? Shout out to all 33 of y'all hanging out here. Hunter B, you must be new. Ma'am. You say B. Okay, cool. You say B. Hey, Hunter B. Hunter BB. Hey, make sure you like. Make sure you share. Make sure you follow. We do these NCLEX style questions all the time. We do them all the time. Gonna make it a norm. Gonna make it a normal type of thing. I might just start bringing one of y'all on here and just make y'all start teaching. Because, hey, you know the best way to learn? To teach others. I'm just keeping it all the way real. Be like, hey, now you get to be in the driver's seat and let's talk about it. And that's another thing, too. For those that are brand new that are about to start nursing school, get into a group. Not me. Oh, Sandy, you first. You the first one. Thanks for volunteering. I appreciate you. All right, what do we got? So everybody's saying D. I think it's the general consensus D. Is that what we're going with? Oh my God, it's B. Is it B? Oh my God, it is B. Oh, okay. You're saying it's B. Okay. So initiate a teenage parent support group with first and second time mothers. Yeah. Is this changing my answer last minute? Look, hey, sir, you know, that's not what we're supposed to do. Hey, remember, a good decision now is better than a great decision later. I'm going to say C. I don't know. Look, I'm going to need for you to say C and just not say I don't know after that. Stick by your answer. Mama of 2 says D. Got you. Mama of 2 says D. Shout out to all 34 of y'all in here. Thanks for hitting up the, you're sticking with D. All right, Rochelle. Don't be coming over here like another 2 minutes and be like, oh my God, it's A. I'm like, look, I ain't even listening to you now. Nope. Mm-mm. All right, what we got? All right, some people say B, some people say C. Majority of y'all are saying D. I learned the hard way by never changing my answer. That's right. I can't even tell you how many times when I took my actual NCLEX, how many times I changed my answer. And even when I was first practicing, I had to really get out of that mindset. I really had to get out of that mindset. All right, so it looks like the majority of us picked D. So that's what the majority looks like. It looks like D. Okay. So I'm gonna go. I'm gonna pick D. I'm gonna pick D in 3, 2. Here we go. What's up, Misha? Hey. All right, D it is. Let's see. And the answer was D. Look at that. Shout out to all y'all that got the answer D. Hey, everybody that picked answer D, hey, go ahead and hit that like button. You know what I'm saying? Go ahead and hit that. Everybody that didn't pick D, go ahead and hit that like button. Go ahead. Give me the 6,000 likes. Because you know why? Because y'all are here and we out here learning together. You see what I'm saying? Can you change the color? Look here. Bless KP. You just came in here. We trying to get it together. Okay. I don't know why it's doing this, but I'm trying to sit here and trying to figure it out. And it's actually like giving me a headache. So I'm trying to figure it out. Never change your answer last minute. That's right, sir. We do not change the answer last minute. All right. So I don't know why the effects are like this. Like, to be honest, let's see. Oh, maybe that's it. I don't know what's happening. I don't know what's happening, to be honest. Filters. Maybe that's it. Oh, that might be it. All right, so that's. I think I found the issue. Maybe is that better? We'll go to original. I think that's better. Or that. Nope, that ain't it. No, we'll go to original. There it is. This has reminded me to go with my gut because the last question I second guessed the same with this one. Better. Okay. I feel like that looks better too. I'm trying, y'all. I don't even know. It wasn't like this last time, but then again, I had it on a PowerPoint. So, bless you. Good. Better. Okay, cool. I'm going to keep it right there. All right. I'm going to keep it right there. So shout out to everybody. Hey, shout out to everybody that picked D. So let's see why. It says because adolescents absorb less information through reading, providing age-appropriate reading material is the least effective way to teach parenting skills to an adolescent. Think about it. A 12-year-old that's 7 months pregnant. You think you're going to, like, the majority of 12-year-olds right now, they want to go outside and play with their friends. They want to play video games, and they want to be on their phones. The only thing they're trying to read is whatever stupidness is popping up on TikTok. That's it. You know that, and I know that. So, I mean, you think about it as another thing. Think about it when you were 12. I know everyone in here is at least over the age of 18, right? So think about it, like, put yourself in that position. What if I was 12 and if I was pregnant? It's only for women. You see what I'm saying? So, had it at your hospital? I'm just saying. Look, I walked into a labor and delivery room, and there were, like I said, I've told the story before, but there were 4 dudes that were in there and 1 pregnant girl, and one was the husband, and the other 3 were not. I'm just saying, go ahead and take that guess on what was going on. And nobody knew who daddy was. Just saying. Is that should be wild out here. Yes, I'm trying to tell you, yo. It's crazy out here. All right. So, laugh out loud. I'm in my 40s hating reading. Look, I don't even read either. I just do audiobooks. Like, I'll find a book. I'm like, man, that's good. Look, that labor and drama. Look, you already know what it is. You already know. I can't go on labor and delivery. Like, I feel so, like, there's a lot of things don't make me feel uncomfortable, but being an L&D, like, nah, I can't do it. Like, you can put me in like newborn nursery, but like labor and delivery, no. But audiobooks, love them. All right, does everybody? I think we all got a good understanding of why this answer is the correct answer. Because what teenager or what kid at the age of 12 that's 7 months pregnant is going to read anything that you give them? A lot of people are visual. You know what I mean? So On to the next one. All right, here we go. Question number 6. A 5-year-old girl, Hannah, is recently diagnosed with Kawasaki's disease, right? Think about what Kawasaki's disease is. Apart from the identified symptoms of the disease, she may also likely develop which of the following: sepsis, meningitis, mitral valve disease, or aneurysm formation. What do we got? Shout out to all 35 of y'all. I need answers. I need answers from all 35 of y'all. I need at least 10 likes. I need for y'all to keep liking this. I need the TikTok algorithm to be like, hey, bro, I see you out there. I see you out there doing good stuff. And I need you to like me. I need you to like me. I need for you to like me right now. Like, love me. Sweet Misery says C, Sweet Misery. Why you gotta be Sweet Misery? Why can't you just be like Sweet Non-Misery? You know what? It doesn't matter. Calliope says C. Is it Naya says C? Cass says C. Sandy says C. Thunder said, whoop, hold on. Brianna says a fever lasting longer than 5 days in a child. Yeah, we all say C, C, C. Rochelle, of course, you gotta be different. You gotta be different, don't you? You want to say D. You're not going with the crowd. You know what? It don't even matter. Shout out to you. Hey, make sure you like right now. Right now. I feel like I'm going to be like, hey, you know what? Who's on punishment? Now you got to like me. Liking my stream is a punishment? Bro, make it make sense. Make it make sense. All right, everybody's saying C. I'm going to put C right here. I'm just going to see how everybody likes it. Hey, no lie. Your name says C. I mean, your name says somebody. It's like somebody says C. I've never heard of this disease, so that's okay. That's okay if you've never heard of it. That's why questions that are like this are important, because it makes you familiar if you've never seen it before. Thunder says, okay, I'm going with C. Stacy says C. Rochelle's like, I feel like I remember something like this. Okay. But the majority of people put C. I think I'm going to go with C. We'll go with C in 3, 2. Oh, it was. Oh. Rochelle, why you going to say wait? Why you going to say wait? Look at that. You about to change your answer following the crowd. Look at you. Look at you, Rochelle. You know what? Rochelle, you on punishment right now. You on punishment right now. Just because you was about to change your answer. You were about to change your Oh my goodness. Rochelle, like, it's too late now. You can't say I'm gonna stick with D. Oh my, hey y'all are something else. Hey, look at Rochelle. Hey, shout out to Rochelle. Hey, but shout out to the rest of y'all, because y'all still answered it. It's not saying that it's wrong, right? But let us read the answer. Kawasaki disease is a rare childhood illness that affects the blood vessels. 20 to 25% of children can also develop aneurysm formation if not intervened. Treatment depends on the disease, on the degree of the disease, but is often immediate treatment with IV gamma globulin or aspirin. Corticosteroids, see what I'm talking about? Can sometimes lessen impending complications. Dude, what the hell just happened here? Hold on, y'all. I don't know why it just got all crazy on me like that. I don't even like the way that looked. Let's fix that. Apparently, it just wants to do what it wants. All right, we'll keep it like that. I think that's better. We'll keep it like that. Can y'all see that? I think that's better, right? Give me some thumbs up out here. Much better? Good. I'm not even gonna lie to you, I was getting a headache. Yes, I got you. All right. Where was I? It says children who experience the disease usually need lifelong follow-up appointments to keep an eye on heart health. And everybody else who picked C, it says Kawasaki disease, also known by the name of, mucocutaneous lymph node syndrome, is an acute self-limiting medium vessel vasculitis. Look at that. Oh, a whole nothing but a tongue twister. That has, goes to the coronary arteries. This can lead to an acquired heart disease in developed nations, and is slowly bypassing rheumatic heart disease in developing countries. There you go. I ain't gonna lie to you. Wasn't even about to try to read all those words. I'm already having a freaking headache trying to read it. It says, Okay, I've got to go to work. When will you be on again? Ma'am, I will be on here on Friday, 5:30 Central Standard Time, Texas time. Go Horns. You know what I'm saying? 5:30 Central Standard Time. So that is when I will be here. Okay. See you then. Thank you. You're welcome. Thanks for coming by. You know, it's always a pleasure to have you. Make sure you like and share. Make sure you tell everybody. All right. So, hey, how do we feel about that, y'all? How we feel about that? Everybody got a good understanding what Kawasaki's disease is? Yeah? How we feeling? Good. Thank you. Okay. Okay, good to go. Thank you. Okay, got you. All right, let's go. Let's go to the next one. See what we got. All right, cool. Question number 7. Let's see what we got. It says, when creating a teaching program for the parents of Jessica, who was diagnosed with pulmonic stenosis, Nurse Alex would keep in mind that this disorder involves which of the following? So it's like, what is pulmonic stenosis, right? I don't know why I picked A. I don't know why I did that. I'm just reading it. A single vessel arising from both ventricles. Is it B, obstruction of blood flow from the left ventricle? Is it C, obstruction of blood flow from the right ventricle? Or is it D, return of blood to the heart without entry to the left atrium? What do we think? Shay says C. C, okay. Calliope says C. Elisa says C. Rochelle, you sure? You sure about that? You sure about that? Jocelyn. Oh, Jocelyn she didn't say anything. Rochelle says C. The Regal says C. Rochelle, okay. I got you. All right, what are we doing? What else we got? What else we thinking? Looks like C is the general consensus of Thunder. Okay, Thunder wants to be different. Okay, Thunder says D. Okay. It says, is it Zandria or Zandria? Zandria says C. Thunder says D. Okay, all right. What else we got? Shout out to all 28 of y'all up in here. If you guys are brand new, welcome to the stream. My name is Kevin. Go by the Boot Nurse on all social media platforms. Make sure you guys check me out. Stella says C. Check me out on YouTube, on Instagram. Misha says C. Also check me out on Thread if you use that, or X, if you guys use that as well. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Are you taking the NCLEX, brand new nursing student, brand new nursing grad? Are you doing your prereqs? Like, we want to know. We're trying to foster a good environment down there. So ask your questions down there. Also, if you're a brand new nurse about to start school, or if you just started school and you want to get a jump on your NCLEX right now, check out the 7-day NCLEX course. That course is going for $48. And once you get it forever. We are in the pre-launch phase, and we are updating. So I'm actually about to update 3 videos today. So once you get it forever. So make sure you guys check that out, okay? It says, Shay S says, I'm from New York. Shout out to the NY. I'm taking my NCLEX next week for LP, and shout out to you, okay? You're going to crush that. You're going to crush it. I wouldn't even sweat it. My name is Danielle. I've got 1 more year till I graduate with my RN. Shout out to you. What is that? Eve Clark. I'm from Houston, starting nursing school, WGU next month. Shout out to you, Eve. I'm actually looking at WGU for my master's. I'm from the NY too. I'm not from the NY. I'm from Texas, and that's just what I do. You know what I'm saying? So sorry, Danielle, I ain't from the NY. You know what I'm saying? Dead ass. I'm not from the NY. I'm just playing. Shay said, thank you. You're welcome. Elisa said LPN from CT 6 years, starting an RN bridge. Okay, shout out to you, Elisa. Stenosis narrowing of the right-sided pulmonary, so option is C is right. Okay, user 14, first year RN nursing student right here from NC, so North Carolina. Okay. Bless says B, new grad ICU nurse from Miami. All right. Did you go to the U? I don't know, probably not. But my name is Brianna, 3rd semester nursing school. Shout out to you. Rochelle, I'm from Maryland. You from Maryland? Hey, you know that dude who does that Wipe Me Down? Every time I think about anybody from Maryland, I think about from him. You should look at USC Master's Program FNP. I don't want to be an FNP, though. That's just the thing. FNP is not in the cards for me, sir. Nurse education is what's for me, because I enjoy teaching. I love all that stuff. Maryland. Hey, you know what I'm talking about. All right, so Let me go. I appreciate everybody giving their input. Thank you for letting me know where you are. I appreciate you guys being here. Make sure you guys like and follow, and make sure you guys share, because you never know who will need this information and who this information will be valuable for, right? All right, so here we go. From Lubbock. Wait, what's in Lubbock? Texas Tech, right? Guns up. Right? Let me stop. Anyways, nurse education is awesome. You'll be a great instructor. I appreciate that, man. I really do. I really do love teaching. Like I said, I've been an instructor for a long time. So, teaching is like what I love. Like, it's one of those things that really gives me my shots of dopamine. Straight up. All right. So everybody said C, obstruction of blood flow from the right ventricle. Somebody else wanted to be different. And since they want to be different, we're not going to pick their answer. I don't know who it was. Maybe it was Thunder. Maybe. I don't know. I ain't pointing no fingers, but it might have been Thunder who said D, but I'm not picking it. So we're going to go with C. And C was the answer. Look at that. C was the answer. Thunder, I'm just playing. I love you. Shout out to you. So PS refers to an obstruction of blood from the right ventricle. Pulmonic stenosis is a defect in the pulmonic valve in which the valve is stiffened, causing obstruction of flow. This disease is typically congenital, benign, and diagnosed in pediatric patients with potential curative treatments. So there it is. I was totally guessing. You ain't got to give me the finger. I'm sorry. Only special people get the finger, okay? But when N's got the finger, that's because she changed her answer. You know what I'm saying? And then, like, when Rochelle got the finger, it's because she changed her answer. You ain't changed your answer. You just stood with it. You know what I'm saying? You stood your ground. Them two, though, they don't know what they doing. You know what I'm saying? I'm just playing. I love y'all. Appreciate y'all being here. Shout out to all 28 of y'all. But does everybody understand why that answer is the correct answer? No, I stayed. Yeah, you stayed this time. Oh, no, you stayed last time. But you was ready to follow the crowd. You was like, no. I can't be the only one. Look at that. Only one that got it right. That's all good, though. That's all good. Because remember, we learning from each other here. You know what I'm saying? I don't go to tech and won't ever go to tech. But have to give you a mess since you rep the horns. Look, okay? You remember when Michael Crabtree, is it Michael Crabtree, who scored that touchdown on the Longhorns in Lubbock, I think in 2009? That was the only football game that we lost. And then we played Alabama, and that's when Colt McCoy got hurt that year. Look, I don't like Michael Crabtree. No, I don't like him at all. You hear me? I don't like him at all. Guns down, guns malfunction, whatever you want to call it. Not a tech fan. Okay? Just saying. But, all right. I think we all good. I think we can roll to the next question. Let's see what we got. Shout out to all 30 of y'all that are rocking with me. I wish that circumstances were better for the questions, but I would rather be able to give you these questions in some way, shape, or form than you not get them at all. And I think we can all agree with that. I think we can all agree with that, right? So let's look at question number 8. Which of the following would Nurse Tony supposed to regard in a cardinal manifestation or symptom of digoxin toxicity to his patient Clay diagnosed with heart failure? Is it? So first of all, think about Think about digoxin. What is it used for? Right? So is it headache, respiratory distress, extreme bradycardia, or constipation? Rochelle says C. Elisa says C. Matt Doyle. Oh, Doyle rules. I'm sorry. Hey, Matt, you got a really cool name, bro. You got a really cool name. I could not help myself. I swear. I don't mean that. No disrespect. This I know. It's C. You sure? Are you sure about that? Are you sure about that? Headache is expected. Okay. All right. So a lot of people are saying bradycardia. A lot of people are saying C. Digs for deeper heart contractions. Right. So, dig toxicity. All right. So everybody's saying C. Yeah, it slows the heart rate. That's exactly what it does. I like that, Rochelle. Look at that. Rochelle. You up in here teaching folks. And some folks didn't even know that. Shout out to you. And you know what? I'm about to bring you on and you about to teach. You ready for that? Who want Rochelle to teach? Hey, I'm about to bring you up. It's about to be like The Price is Right. But it's like you don't want to go up, but I'm about to bring you up here. Thunder wants you up here. A user 14 says A. I'm in farm right now. Okay, that's gonna help. Hey, you're welcome. Okay, good. Shout out. Look at you. I love it. I love it. Look at you. Look at you. Definitely is C. That's why you don't give it if the apical pulse is less than 60. Look at you, Elisa. Okay. Put her on blast. Pass her the mic. Look, she probably get up here like, look, y'all, sounding like Popeye, stuttering. Oh, stuttering. No, I'm just playing. Oh, hey, Rochelle, I'm just want to let you know, you're the one I'm picking on right now. You're the one I'm picking on the whole time. You know what I'm saying? But it's all out of love. And it's because, hey, look, I love how the fact that we're all sharing all this knowledge together. Okay. So the general consensus, it looks like it's C, right? The general consensus is that it is C. All right. Shout out to all 40 of y'all. All right. So I think that it's not ridiculous. It's either A, B, C, or D. Danielle, come on now. Come on. We have to do it all in one semester. Oh, that's why you said it's ridiculous. Oh, okay. I got you. I'm tracking. Oh, okay. All right. So general consensus is C. We're going to hit it up in 3, 2, 1. No, I'm picking up what you're putting down. Oh, shout out to y'all for picking C. Shout out to y'all for picking C because that is the correct answer. Once again, Rochelle is out here, like putting it down so y'all can pick it up. You know what I'm saying? She out here like giving y'all some little tidbits, dropping them dimes. You know what I'm saying? I appreciate that. Extreme bradycardia is a cardinal sign of digoxin toxicity, right? Increased intracellular calcium from the poisoning of, what is that, sodium and potassium transporter and AV node blockade from increased vagal tone are the primary cause of digoxin toxicity. The former leader to increase, automatic. Like, why? Why, God? Why do that to me? And it's an inotrope, right? So I'm not even going to read all that. Like, literally just gave me a headache. Why use big words like that? Anyways, you get extreme. That's how you know you gave too much dig. When that heart rate is way below 60. That's how you know. That's how you know, right? Constipation? Nah. Respiratory? Maybe. Headache? Expected, right? But this, right, you always have to check your heart rate before you give dig. This is a question that you would actually see on NCLEX, but it would be actually a little bit more thorough than that, right? Especially if I gave you a scenario about a patient who has, who has a heart problem, and they give you an entire scenario. They'll be like, oh, the patient took their daily dose of digoxin, but they came in, for a low heart rate, and now they have a low respiratory rate, so on and so forth. You're gonna be like, oh, what happened? And then you get the history from the patient, or the history from the family member that's telling you, well, he took his medication like an hour ago, and you're like, oh, well, that might be it, because they didn't check their vital signs before they took their medication. Okay, but hope that makes sense. Hope that makes sense to everybody. Apparently, Rochelle's the new teacher, so I'm just gonna let her do her thing in the chat. Rochelle, you got it. Do you? No, I'm just playing. Y'all ain't here for her. Y'all here for me. Shout out to all 41 of y'all that are up in here. Welcome to the live stream. If you guys are new here, my name is Kevin. I go by the Boot Nurse on all social media platforms. We're doing NCLEX Calc questions right now. Multiple choice. Some select, all that apply. New generation NCLEX Calc questions are going to be coming soon. I just grabbed some stuff off the computer for us, right? So if you're new, I want to know who you are, where you're coming from, where you're at in your nursing journey. We're trying to foster a good community down there. I want you guys to start, jumping into the chat. Let's be active up in there. But now we're going to go on to this question. Is it considered as the bluntly round, is it considered as the bluntly round portion of the heart? Is it the base, the pericardium, the aorta, or the apex? So now let me ask all 34 of y'all a question right now. If this question right here popped up on NCLEX, this question right here with these answers, is this a passing level question? Is it a passing level question? Does this involve critical thinking or clinical judgment? We say no. Now, let me ask you. So the NCLEX is a computer adaptive test, right? First of all, shout out to Alex. Shout out to Alex Trebek. I thought you said no Alex as his Calliope, like we were on Jeopardy. I was like, Alex Trebek, he's a national treasure, okay? But if you start getting questions that look like this, because this is what we would call a remembering or a memorization question. All right, this is part of the anatomy. This is something that you learn in anatomy and physiology before you even get in nursing school, right? So if a question like this pops up on your NCLEX, do you think that you're passing? And I'm going to answer the question for you. The answer is no. Because this is a remembering question. This is not a thought-provoking, analyzing, and an application question. Okay? I want everybody to understand that. Because I remember when I started to understand all of this, I got a question that was like this, where it's like, you have a patient who has a respiratory rate, blah, 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 blah. What disease process do you think they have? And there was only one that made sense, and it was pneumonia. And I had to stop, and I was like, oh my God, I'm not doing well on this exam. I'm not doing well on this exam at all. So what? I had to stop. I had to get my anxiety under control. And at this point, I wasn't studying the way that I was supposed to be studying. This was NCLEX number 2, where I got 265 questions. A lot of y'all don't know nothing about that. Some of y'all do, some of y'all don't. But I'm just being all the way honest. All right. So if you get questions like this, just know that it's not a passing question. It's not a passing level question, right? How come that means you aren't doing well on the NCLEX? Because it's a remembering question. There's 4 tiers. It's like remembering. I forgot what the second one was, and then it's analyzing and applying. The analyzing and applying type of questions are the questions that you want. Okay? Because those envelop critical thinking and clinical judgment. What type of thinking is this question? Literally, this question was up there like D, because it's a question it's something that you learn in anatomy and physiology, is it not? Something that we all learn in anatomy and physiology. Like, what is the blunt, round portion of the heart? The apex, the base, the aorta, the pericardium, right? So if you see a question like this come up on your NCLEX, and remember, your NCLEX is a computer adaptive test. It gives you questions based off of how you answered the previous question. Okay? Shout out to all 47 of y'all that are in here. I really want everybody to really pay attention to that, because if you start getting easy questions like this, you might want to slow down and you might want to get your anxiety under control, because if you're getting questions like this, you're not doing well. You are not doing well on your NCLEX exam if you get questions like this. All right? It's not to scare you. I'm just keeping it all the way real. Shout out to all 48 of y'all up here. You see what I'm saying? Yes. The NCLEX is computer adaptive. As a matter of fact, I actually created a lesson on the new NCLEX test plan, as well as talking about, what's on the NCLEX. That's in my course, the 7-day NCLEX course. If you got it, you know what I'm talking about. Can you come back from that? Yes, you can come back from that. So here's the thing. So what is the minimum? Oh, first of all, let's answer this question and we'll talk about that. So everybody said D, right? You make a good coach. You make a good coach. Hey, that's why I coach, baby. Shout out to all 56 y'all in here. All right, so everybody came to a general consensus that the apex is the round, the bluntly round portion of the heart, right? I'm going to answer this question right now, and then I'm going to answer your question, Rochelle. All right. What state you work in? I live in Texas. All right, cool. So we got that. So I'm going to answer this question, and that is the correct answer. It is the apex. I'm not even going to go into this question. I'm not even going to read it, but I am going to answer you, Rochelle. So you asked, can you come back from that? And I'm going to give you a prime example of what happened to me. On my second exam, I got 265 questions. If anybody knows how the old exam was prior to COVID, you got 75 questions at a minimum, 265 questions as a maximum, with 6 hours for you to take that exam, right? I got to question 76, and I about shit myself, because I was like, dude, what the hell is happening here, right? And then by the time, I kid you not, I was at question 160 and then 180. And then I got to question 200. And when I got to question 200, I had a question like this. And I noticed, right, so the minimum now is 85. But before they changed it, it was 75 questions as a minimum. I'm just going to call you Dream 92, okay? So before they changed it, it was 75 to 265, right? And then when I got to question 200, I had a question like this. And I instantly knew that I was not doing well. So I had to slow down. But remember, I'm timed. I'm at question 200, and I have 22 minutes left. So now, of course, my anxiety is through the roof, right? Now my anxiety is through the roof. So as my anxiety is through the roof, I'm just like, all right, cool. Kevin, you got to relax. You got to look at this. You got to read them. Then the questions started getting a little bit better because I was taking my time. But then I got to question 230 and I had 6 minutes left. And at this point, I didn't know about the run out of time method. I didn't know about any of that, right? And if you don't know what the run out of time method is, it means that you have to at least hit the minimum. And if you run out of time when you take your exam, the exam will grade whatever you have. But you at least have to be at the minimum, which at that point it was 75. Now it's 85, right? So the reason why I say that is you get to this point. You really need to take your time. You got to slow down. I don't know what FKR means. FKR shut off on me at 93, took it once. Well, shout out to you, Lisa, for taking it once. I took it 3 times, right? Last time I shut off at 110. So the first time I took it, 75 questions. Second time, 265. Third time, 106. The last time I took it on the fourth time, it was 60. And that was during COVID, like right when they shut everything down in like March and in April or whatever. It opened up in May. They canceled mine and I had to do it again in June. I had to reschedule it for June. Took it in June of 2020, passed, right? I never heard of the run out of time method either. So there is a method called the run out of time method. You know what? Let me see something. I'm gonna see something. I'm about to show y'all something exclusive, kind of, sort of, but maybe not really. I don't even know where it's at, to be honest. Oh, nope, that ain't it. I'll find it somewhere on here. But yeah. So there is a method called the run out of time method. So, and it's exactly how I explained it to you. So think about that. All right. And it's not to scare you, but it's to be honest. It's reality. If you're in a situation like this, that's where you are. Okay. But then think about it. If you go over 85 questions and then you get to question 86, take a deep breath and keep going because you're still in the game. All right. Give me some love. Give me some love. Y'all know what I'm talking about, right? So we're still in the game once you get to question 86. That's why when I tell people that I'm coaching, you are going to do a minimum of 85 questions because your NCLEX is 85 questions. You are going to do a maximum of 150, right? I try to tell people do 85 to 150 questions every day or every other day, right? Don't do any less than 85, but don't do any more than 150. I had 90 minimum questions. What are you talking about, Sarah? And what? On what? LPN? Because an NCLEX RN is 85. And if you had a minimum, that means that the test shut off for you at 90 questions for sure. Okay? All right. I think I'm done talking about this. Mine had 150 cutoff, passed first time. Thank goodness, right? NCLEX 13 years ago. Okay, so you had the NCLEX that I had, Sarah, which was 75 to 250 or 265. What helped you pass the NCLEX? I had 75. Yep. Honestly, I had to redo my entire thought process. I had to cut people off. I had to recreate the testing center. I already knew what the testing center looked like. I might as well have just had a timeshare there because I've been there so much. You see what I'm saying? So that's one thing I would tell you is I created a what is it, like a time management? Like I literally wrote it all. I wrote out everything, right? I created a study plan for myself, and I started with the hardest section first, and then I worked my way through. I did NCLEX style questions every day to every other day. I did content every day. I gave myself a day to 2 days throughout the week to give myself a mental break, but no more than that. I used UWorld. I didn't like UWorld because they didn't give me content, and that's what I needed, and that's what I knew I lacked. I always tell people, hey, get something that's going to give you everything. And if you don't use it, cool. But at least you know that you have it. How's the saying go? Better to have it than not need it, than need it and not have it. I think that's how it goes, right? Most of my questions were select all to apply. I had 9 select all to apply questions out of all 60, right? UWorld works for a lot of people, but me personally, I didn't like UWorld. I liked Simple Nursing. I liked Simple Nursing's YouTube channel. I did. I've never purchased their NCLEX stuff, or I've never bought into his program or that program. I think it's like $40 a month or something like that. I'd never do it. ATI, trash. Archer, I like. All right, so Y'all keep answering me with the question. Shout out to all 61 of y'all in here hanging out. I know we can see this a little bit better now. Shout out to all of y'all. If you guys are new here, let me know who you are. My name is Kevin. I go by the Boot Nurse on all social media platforms. So make sure you guys go over there. If you know anybody that may miss this, tell them to subscribe to my YouTube channel, because any TikTok live that I do, it goes up on YouTube. There's actually, I think, 2 or 3 videos that I need to put up there that I haven't put up there yet. So I want to make sure everybody gets that. Make sure you guys like, make sure you guys follow. So hard to read. Chan, you must be new here and you must have just got in here. It's hard to read because I didn't have enough time to put this on a PowerPoint. So yeah, I just don't like ATI in the way, I don't like ATI, and I really don't like HESI because I didn't like the way that HESI's stuff was formatted. And plus the way that they do HESI and ATI, it's like a racket. Same thing with Kaplan, like when you're in school. Like they force you to do those things. They force you to do NCLEX style questions on ATI and especially like on HESI. But when I was in school, they didn't teach us how to do NCLEX style questions. They just gave us stuff. Like they just gave us like their the school's test, rather than, giving us NCLEX style questions from the beginning. So HESI is trash. ATI, I've looked at that and I don't like that either. NCLEX on September 11th, please change your date. I'm just kidding. Have I used Kaplan? I actually did use Kaplan. I used Kaplan's NCLEX review. It's probably, I think, one of, or if not, probably the most expensive NCLEX review that's out there. Kaplan's been around for like the 70s or 80s. I think they're like $450 for like 3 months or something like that. But, you get everything under the sun that you would need. I love them. They're actually like one of the reasons Kaplan and Mark Clement like gave me the motivation to come out here and to like teach y'all, the easier ways, rather than talk about all X, Y, and Z. That's just me though. But I love Kaplan. I love Kaplan for me. It may not work for you, but they're out there. Damn, I just started school and we use HESI. Look, is it Candice? It'd be like that. Tay, you're welcome. Honestly, it'd be like that. And so the one thing I would tell you is that if you guys are using HESI, like you need to be looking at the HESI style questions, because my school would do the institution type of classes, or institution, like their own created freaking exams. And then they would make the exit exam the HESI, and they'd make it 30% of your whole grade. In every class except for fundamentals, every class I had like a 94 or 95. Like I'm not a stupid person. But then when I took that HESI, it would drop my entire grade like 9 or 10 points. And so I end up with a B in almost everything. All because I'm just like this is not accurate. And for me, it damn sure didn't help me prepare for NCLEX. You know what I mean? So there's that. Shout out to all 50 y'all that are in here. Make sure you guys like. Make sure you guys follow. Make sure you guys follow me. I need 10,000 people to follow me so I can stream from the computer. That way y'all ain't looking at all this nonsense that's going on over here. All right, so here we go. Which of the following disorders leads to cyanosis from deoxygenated blood entering the systemic arterial circulation? Is it A, aortic stenosis? Is it B, coarctation of the aorta? Is it the patent ductus arteriosus, or is it tetralogy of Fallot? TOF, TOF. I'm just going to call you PJ for pajamas. PJ says D. Toph says, Betty says Toph. Okay. Jonah says D. Jonah said, our entrance and exit is HESI, and we have HESI in every 8 of our modules. It's terrible. It is terrible. I hated it. I hated every bit of HESI. We had to score over 900 on comprehensive HESI in order to graduate. I hated it. Yeah. Put it this way. So many people in the school that I went to didn't do well on HESI that my school ended up on the board of nursing's radar for all these people that are passing their classes but not graduating. And our school was almost under the investigation by the board of nursing. So they actually changed it and gave people a remediation program. And in reality, if you're able to pass school, that's cool. But if a school's NCLEX rating starts to fall, they're on the board of nursing's radar. And then they can lose their accreditation. Because the whole point of nursing school is not just for you to pass it. I mean, the whole point of nursing school is for you to pass it, but they're supposed to train you for you to become a nurse. Period. Yeah, that is saying something, right? All right, everybody's saying D. I know I'm going off on a tangent here. So somebody's saying D, 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 D. Some other people said D. D looks like the general consensus is D, right? So tetralogy of Fallot. All right, I think we're good with that. I think actually we should just go ahead and answer that. Let's answer that. We'll put D, tetralogy of Fallot. If anybody objects, go ahead and put your answer, but it don't matter because I'm about to pick this answer anyway. Shout out to all 66 of y'all. Here we go. And tetralogy of Fallot is the answer. So here's you guys' rationale. I don't even know if I want to read it, but here's you guys' rationale if you guys want to read it. Did somebody's name say Sandy Cheeks? Talking about like Sandy from SpongeBob? Is that what we're talking about? Look, y'all wilding out here. Shout out to all 63 of y'all. Hey, if you guys are new here, welcome. My name is Kevin, your master of ceremonies and your weekly clown and coach going through NCLEX style questions. If you guys are new here, I want to know who you are, where you're from, where you are at in your nursing journey. Let us know. We're trying to foster a good environment, and let us know down in the comments. If you're a brand new nurse about to start nursing school, especially those that are about to start nursing school, and you want to get a jump on NCLEX, check out the 7-day NCLEX course for $48. It's 80% off the current price. The link is in my bio. Once you get it forever. So everything that I update in there, from content videos to NCLEX style questions to NCLEX style question videos on how to break questions down, like we're doing right here, and we're talking about them. That's what we're doing, baby. Oh, you from BMO? Oh man, graduate in 10 months. Baltimore, is that how you say it? Hey, I ain't from the East Coast. I ain't from Maryland. You know what I'm saying? So somebody else in here is from Maryland too. So Illinois, finishing up 2 weeks of school, ADN. Shout out to you, Candace. Shout out to you. You in Jersey, Shan. She's like, I'm from Jersey. D-Town. Shout out to Dallas. Just graduated. Okay, you in my neck of the woods. I mean, you're like 4 hours away, but you in my neck of the woods. Okay. What test bank is this from? I grabbed this test bank from nurseslabs.com. That's where I grabbed it from. Matthew says 12 months an accelerated program, 12 to go. 12 months and you got 12 to go? You just started, Matt? Is that? Can I call you Matt? I call you Matt. Like Matt the man. I got you. I got you, big dog. I got you. Shout out to all 52 of y'all up in here. Hey, make sure you guys like, share, and follow. I need 10,000 people to love me. Okay. Ooh, you're still on here. You already know what I'm doing. All right. And what question is this? Is this question 10? We're at question 10. I think we'll finish up at, hey, put it this way. I'll keep going. We'll go to question 12. How about that? Y'all cool with that? We'll go to question 12. Y'all cool with that? Hey, I need love. That's because PEDS is hard. PEDS is hard. Last time I was doing questions on management of care, people were getting them. Some people were stumped, but PEDS is definitely a hard. Hey, so I just want to let y'all know, pharmacology, pediatrics/maternity were the two hardest sections for me personally. All right. Question 15, if we can get you to 10K. How about question 15, if you can get me to 20K? How about that? No, how about this? I'll go to 20 questions if y'all can get me higher than what y'all got me on Monday, which was at 21.7. How about that? Bet I'm gonna try. Look, let's make. Hey, yo, you can't be the only one over there smashing that like button. If y'all want me to keep going, y'all got to keep smashing it. I'm just letting y'all know. All right, here we go. Question 11. Betty is a 9-year-old girl diagnosed with cystic fibrosis. So what is this disease process, right? Think about it. Which of the following must nurse Archie? First of all, Archie, whatever. Which of the following must nurse Archie keep in mind when developing a care plan for this child? Pulmonary secretions are abnormally thick. Elevated levels of potassium are found in sweat. CF is, what is that? It's an whatever, bro. Like dominant hereditary disorder. Obstruction of endocrine glands occur. Which one? What are we talking about? Obviously, I didn't know how to say this word because I'm slow. All right, we're saying A. All right, I'm just going to leave it on A right now. Misha says A. Shay says A. All right, cool. What we doing? All right, we got 58 people in here. Shout out to all 58 of y'all. Make sure y'all smash that like button and make sure you guys participate. All right, participate. This is the only place where you get lots of love for participating. Kinda, sorta, maybe. A. Oh. All right, PJ. PJ says A. It's Bubbles. Like from the Powerpuff Girls Bubbles. Shout out to you. Say A. Okay. All right. Hey, make sure you guys follow. Make sure you guys like me. Make sure you guys do all that stuff. All right. Make sure. Candace says A. All right. Cool. All right. Oh, really? Okay. Okay. Rochelle. I don't know where Rochelle went. She just started answering questions and just thinks she's better than everybody, so she just left. Okay. Beautiful 2018 says A. Beautiful. You can't just be beautiful only in 2018. You gotta be beautiful every day. You know what I'm saying? We're in 2023. That's what I'm saying. Words of affirmation. We're about putting it out here. You know what I'm saying? 65 folks. All right, cool. Bliss says A. All right, cool. So it looks like A is the general consensus. So let's pick A and let's see what we got. And the answer is A. So, cystic fibrosis is identified by abnormally thick pulmonary secretions. Researchers now know that cystic fibrosis is an autosomal, recessive disorder of exocrine gland functions, most commonly affecting persons of Northern European descent at a rate of 1 in 3,500. It is a chronic disease that frequently leads to chronic sinopulmonary infections and pancreatic insufficiency. The most common cause of death is end-stage lung disease, right? So this is obviously an airway issue, right? So think about it. It's not acute. It's chronic for people that have it, right? Whoop, whoop. Shout out to all y'all that picked A. Shout out to all y'all. All right. I think we're good. I don't think anybody has any questions on that. I think we can move on to the next one. Let's see what's cracking. All right. Number 12. Alice is rushed to the emergency department during an acute, severe, prolonged asthma attack. All right, so look, we're painting a picture here. And is unresponsive to usual treatment. So think about it. What is the usual treatment for somebody who has an asthma attack, right? The condition is referred to as which of the following? Is it status as asthmaticus? Hey, I said I was good at coaching. I didn't say I was good at spelling things out. Active airway disease, was it intrinsic asthma or extrinsic asthma? Inhaler, right? So we say A, okay. PJ wrote it all the way out. Okay, I got you. Bubble says A. Okay, say A, all right. Hey, look, we're at 13,000 likes. That's what I'm talking about. 13,000 likes. I'm putting A. Jonah says A, okay. Okay, hey, y'all keep smashing that like button. We're going to get all the way to 20. Shout out to all y'all. Hey, if you're new here, my name's Kevin. I go by the Boot Nurse. We're doing NCLEX style questions. All right, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Let us know down in the comments. Got a bunch of nurses, a bunch of nursing students that are either in the position that you currently want to be in or have been in your position. All right, so if you got any questions, make sure you guys drop them down there, okay? So general consensus is like A. So I'm going to put A. I don't think we have any arguments there. And the answer is A, right? So it is an acute, prolonged, severe asthma attack that is unresponsive to unusual treatment. And it does require hospitalization. One of the most common causes of the emergency room visit in the United States is status asthmaticus, an acute emergent episode of bronchial asthma that is poorly responsive to standard therapeutic measures. So shout out to all of y'all. I got the answer right. I don't think anybody picked the wrong answer, right? I kind of wish Rochelle was here because she probably would have changed her answer. I'm just playing. She ain't here to defend herself, so that's not fair. All right, so here we go. Question number 13. It says, baby Melody is a neonate who has a very low birth weight. Nurse Josie carefully monitors her inspiratory pressure and oxygen concentration to prevent which of the following? Is it meconium aspiration syndrome? Is it bronchopulmonary dysplasia? Respiratory, this is RSV. I always never, whatever, bro. It's RSV. Or you have respiratory distress syndrome. Say D, okay. D. User 80 says A, okay. Unless you were saying A to like the previous one. Thunder says D. Jack says D. Is it Fluff? Fluff says D, okay. All right. Fluff says D. All right, well, looks like I'll keep D there. We'll see what everybody else is thinking. Regina says D. Stuck between C and D. Well, beautiful. You gotta pick one. You gotta pick one. You gotta pick one. You gotta pick one. You gotta think about what is a neonate? What is a neonate going to look like? Right? What has been your favorite unit to work on? I honestly like the PACU when I worked there. What Q and what QB is that? What do you mean? What QB? What are you talking about? Bubble says D. Okay. So it looks like we have preemies. There you go. Right. So what does a preemie look like? Is a preemie fully developed? What are we looking for when we what is the biggest thing when a baby is born? Right? Question bank. Hold on, let me see what question bank is that? So this is the pediatric question bank. So think about those things. It's like babies that are neonates aren't, they require a lot of help because they're not fully developed for what they are definitely on the struggle bus. Absolutely. So everybody's saying D. It looks like the general consensus. I think we have somebody say between C and D. So the answer was B. Wow. Okay. It was B. Now let's find out why. This is why it's so important that you read and review all of your questions, even if you got it right. Let's find out why we picked the wrong answer, right? Close monitoring of inspiratory pressure and O2 concentration is necessary to prevent bronchopulmonary dysplasia, which is related to the use of high inspiratory pressures and O2 concentrations, especially in very low birth weights and extremely low birth weight neonates with lung disorders, right? Injury from mechanical ventilation and reactive oxygen species to premature lungs in the presence of, antenatal factors predisposing the lungs to PBD form, the basis of pathogenesis of beta and pre. Okay, all right, cool. So obviously you don't want to be like blowing them up. Lungs. Well, totally missed that one. That was actually a hard question. If you don't know about neonates, you would be like, okay, what is the bronchopulmonary blah 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 blah. So essentially all of these, like this airway, that airway, airway breathing, right? So this is where it's just like, okay, I don't know it. This is why I love going through practice questions. I don't know it. Now let me see why. That's why. Oh, okay. Right? And then it says it was for D. It says RDS, a disorder caused by lack of surfactant, usually is found in premature neonates. Right? It says just lectured over this Monday. I know what to study now. Look at that. Look at that, Jonah. Look at that. All right. And we'll go on to the next one. Right. So so here's the thing. It's just like, you're going to get questions wrong. You're not going to be perfect by any means. You will not be perfect. All right. It's okay for you to get them wrong, but you need to know why you're getting them wrong. You can't just be like, oh, I got it wrong. You're going to feel nervous. You're going to feel like you're not smart enough, but trust and believe me, the NCLEX is based off of a 0 to a 100 scale. And you just need to be above the standard. And just think of the standard being, it's 50%. What test do you know that you need to get above a 50% to pass? A 50% and above, right? You need to get it over. You need to get it over the 50%. I'm in a cardiac unit right now this semester. Okay, look, shout out to you, Ron. Learn all you can about the cardiacs. Learn all you can about the cardiacs. You know what I'm saying? So, all right. Shout out to all 36 of y'all. Hey, we're at 17.3K likes. Y'all must really want 20 questions. Shout out to y'all. Grace says, hey, Grace, I ain't even read it yet. All right, cool. But hey, you're early adopter. Early adopter, give me your answers out there. I appreciate that. Shout out to all 38 of y'all. If you guys are new here, my name is Kevin. Go by the Boot Nurse on all social media platforms. If you missed any one of my other TikToks, make sure you guys go to YouTube, and that link is in my bio. And you guys can check out all the other missed TikToks that you may have missed where I did a couple of NCLEX style questions and, we just sat here and we talked. There's only one A there. You don't need to put so many, but I got you. You know what I'm saying? I'm only a sophomore BSN student too. That's okay, Grace. It's better for you to understand and look at this now rather than you getting all the way to your end of your semester and you're just like, what is this? I'm confused. You know what I'm saying? And also, and I say this to all my new students and all the people that just started school, or if you got like another year or two, check out the 7-day NCLEX course. It's for $48. You get it forever. And the only people that get it forever are the people that are early adopters at this point, right? We got about 100 students up in there so far, and everybody is all about it. You know what I'm saying? I'm uploading 3 videos tonight, so be ready for that, all right? So an NCLEX style questions, such as new generation NCLEX on how we break the questions down and everything, those are coming. I'm listening to all the feedback that what y'all want rather than what I think you need. And I know what you want. You want NCLEX style questions. You want to know all about this and you want to know how to break them down. I promise you, I got you. Okay. So, hey, let me know who you are, where you're from. Drop your stuff down there and participate in answering the question. Even if you get it wrong, we're going to find out why you got it wrong so you don't get it wrong next time. Okay. Which of the following instructions should Nurse Cheryl include in her teaching plan for the parents of Reggie who has otitis media? Placing the child in the supine position, to bottle feed, prescribe amoxicillin on an empty stomach, clean the inside of the ear canal with cotton swabs, avoid contact with people who have upper respiratory tract infection. Some people are saying D. Some people said A. Dream 92 said A. I don't know. You sound like a goat. Like I'll just play it. You don't lay babies flat to feed them. D. I changed it. No, you can't. No, it's fine. You can change it. If you can do whatever you want. But hey, remember. Hey, how does the rule go about changing your answers, huh? How does the rule go about, unless you can tell me 100% on why you change your answer, you better not change it. When you're taking an exam, I want you to hear me. As soon as you change the answer, I want you to hear my voice saying to you why you changed the answer. You better be able to give imaginary me a definitive answer on why you're changing it. And then you're going to hear me say, okay. Okay. Abigail. I'm going to call you Abby. Can I call you Abby? I feel like everybody calls you Abby. Abby. Welcome to the stream, Abby. Swimmer's ear is, so nothing is in the ear. Yes. Yeah. Antibiotics with foods. Should be given with food, not on an empty stomach. All right. It's D. D. So it's D. Okay. Heather James says it's B. Okay. All right. But it looks like the overall answer looked like it was D. It looked like it was D. I see more D's than anything on here. I see a few A's. I see like maybe 1 or 2 B's, but I see D as the overall answer. All right. So I'm going to pick D because D is the overall answer. All right. And here we go. Process of elimination. PJ, that's right. That's what I'm saying. I think A because milk can pull into the eustachian tubes. Okay. Cool. That could be it, right? But think about this process, right? Think about what is otitis media, right? So what do I want to inform my parents when I'm teaching them, when it comes to this disease process, right? And I'm not giving you the answer. I'm just saying when you're analyzing your questions, what do you pay attention to, right? So which of the following instructions should Nurse Cheryl include in her teaching plan for the parents of Reggie with otitis media? So what is the teaching plan I give my parents for this disease process? Okay. Not supine feed. So people are saying A. Okay. So people are saying A. Some people are still saying D. Fluff. You can't pick B or D. It could either be B or D. You have to pick one. You don't get the choice where you can just be like, I want B and D. They're like, wrong. You see what I'm saying? They'd be like, wrong. Shay says D. Man, y'all are all over the place. Y'all are all over the place. So some people say A. Some people say D. Somebody says B. Right? Somebody says D. Okay. All right. So D was the one. There are more answers for D than there are for anything. All right. So I think I'm going to go with the general consensus of going with D. Since just check it. Hey, Jay. Okay. All right. Since AJ wants to rush me, I guess I'll just answer the question. All right. Here we go. In 3, 2. Listen, did you know that Blueface has a new baby mama and that other girl, Krishan, is pregnant? Now you do. I'm sorry. I couldn't know myself. I'm going to answer right now. Oh, Abigail, you must be new here. You must be new, okay? All right, look, the answer was D. Look, what I do? Abby, you wrong. So I'm gonna tell you why you're wrong. You ain't liking, you ain't following, you ain't doing none of all the things you're supposed to be doing. Okay, all right. You gotta follow, you gotta like, you gotta say, hey, this is what we doing all the time. You know what I'm saying? This is what we do. All right, but the answer was D. Avoid contact with people who have an upper respiratory tract infection. Otitis media is commonly precipitated by an upper respiratory tract infection. Therefore, children prone to otitis, that's dumb, otitis should avoid people known to have an upper respiratory tract infection. Acute otitis media is the second most common pediatric pediatric diagnosis. Oh my God! Emergency in the emergency department following an upper respiratory infection. Although otitis media can occur in any age, it is most commonly seen between the ages of 6 and 24 months. Obviously, I don't know how to talk. Shout out to all 51 of y'all that are in here. Shout out to y'all getting me to 21,000 like y'all want me to go to 20 questions. I appreciate all y'all. Hey, look, listen, y'all know I had to get one of those where, hey, y'all be rushing me. That's the stuff that y'all be getting. You know what I'm saying? I'll be delaying. Sometimes I don't know where this check button's at. You know what I'm saying? I'm just saying. All right. So here we go. We're going to go to the next question. Hey, shout out to all 45 of y'all that are in here. Hey, if you're new, my name is Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go over there and check them out. Instagram, of course, here, TikTok. Make sure you guys follow. I need 10,000 people to like me so I can stream from my computer. Go follow me on YouTube in case you miss any of these TikToks. You'll be able to pick those up. And also, if you're a brand new nurse, about to start school like this week, next week, September, whatever, check out the 7-day NCLEX course. That link is in my bio. $48. You get it forever. All right, here we go. Question number 15. Hello, I'm a new nurse. Where do you go? Where do I go live? Only here on TikTok. I don't like this question. Look, Abby, okay? When you take that NCLEX, you ain't gonna like that either. Okay? So you're gonna have to pick your poison. Okay? All right, here we go. When assessing a child's cultural background, the nurse in charge should keep in mind that heritage dictates a group's shared values. Physical characteristics mark the child as part of a particular culture. Cultural background usually has little bearing on a family's health practices. Or D, behavioral patterns are passed from one generation to the next. I take it in 2 months. Oh, Abby, you will be Gucci. Trust me, you will be good to go. D. This is a tough one, yeah? Or this is a rough one, yeah? It is. Who is it Mish 8089? I ain't never seen you before, ma'am. Is it Tessa says A? All of y'all that are new here, I'm gonna need for y'all to share and I'm gonna need for y'all to like. Not just share, but like me, follow me, be friends with me. I need 10,000 people to be my friends so I can stream this on the computer so y'all ain't gotta be looking at all this craziness right here. You see what I'm saying? So we got some C's. What's it? Happier now? You know what would make me happier? If you followed me. Yeah, see what I did there? Now you do. All right. So what is that? Let's see what's going on. Fatima says A. Is that Fanny? Fanny says A. Right. Candace says A. Right. Candace says A. I'm going to go with A. Okay. Abby Beauty says D. All right. So it looks like the general consensus is A. Looks like I saw a lot of A's pop up. I did see a lot of A's pop up. Okay. We're going with the masses. Betty says D. Okay. Christina, ain't ever seen you before, but she goes by A. Ha! What is this, Pretty Little Liars? I'm just playing. She picks A. Nelly says D. And IDK. Well, there's only, okay, I got you. I'm tracking. I'm picking up what you're putting down. I got you. Okay. Travel with me. I can't travel with you nowhere if you ain't liking and following. But I will take that answer, which is D. Got you. It doesn't make sense. There's a lot of questions that won't make sense. Trust and believe me, there's a lot of questions that won't make sense. But sometimes we got to work with what we got. And remember, these are questions that I just pulled from nurseslabs.com. So they're, that's what they have. Misha says I'm taking my NCLEX on Saturday. Wait, they allow you to take your NCLEX on Saturday? I thought it was only Monday through Fridays. Whatever, that's cool. Shout out to you for taking it on Saturday. You'll get those results on Monday. 48 hours. You're going to do all right. You're going to do all right. All right, so it looks like everybody, I saw more A's than anything. So A is the answer by the masses, and that's what I'm about to pick. All right, so don't get mad at me. All right, just letting you know. But that's why we practice here. That's why we do all this practice. Y'all got me to 22,000 likes. Look, hey, nothing but love. How many questions are on the NCLEX? 80, minimum 85, but max of 150. But it all just depends on you. You can get 85, or you can go all the way to 150. Oh, and the answer was D. The answer was D. A family's behavioral patterns and values are passed from one generation to the next. Pediatric healthcare providers must be aware of the demographic trends and be culturally competent to deliver the safest, highest quality care possible to children and widely differing groups. Yes, we got the answer right. Yes. Hey, so shout out to everybody that picked D, right? But everybody that picked A needs to know why that answer is correct. And this is why that answer is correct. And now if you picked A, let's check out why the answer is wrong. Although heritage plays a role in culture, it does not dictate a group's shared values, and its effects on culture is weaker than that of behavioral patterns. In addition to language differences, cultural differences regarding nonverbal communication can create communication barriers between a child, family, and the healthcare provider. Okay. Yes, this is Nurse Labs. This is Nurse Labs. All right. So, what are your thoughts on ADN versus BSN? Doesn't matter, to be honest, as long as you go. You're welcome. Oh, you're not even talking to me. But my thought process is go get what you can get. If you can only financially, be able to get your LPN, go get it. If you want to move up from your LPN to go get your RN, do that. If you want to not do that, then that's cool too. I know for me personally, I went for my BSN because I was trying to get commissioned in the Navy, and you have to have a bachelor's. That's the only reason. I didn't even know you could get your associate's degree as a nurse. Didn't know that until I was already a nurse. I was like, wait, I could have got my license a whole long time ago, and I would have went so many different directions with that. But hindsight's 2020. I know what you don't know what you don't know then, but I know what I know now. So if you want to go get your ADN, cool. And if you want to get your ADN and work your way up to BSN, cool too. Put it this way: one of the managers that I'm cool with at my hospital, she's a manager, and she has her associate's degree, and she's a damn good manager too. So I can't say that about a lot, but she's really good, and everybody thinks that she has her master's. And I'm like, how do y'all put her in a position not know she has her master's or doesn't have her master's? But whatever. But she's a great nurse and a great leader. So question number 16. Dustin, who was diagnosed with, is it Hirschsprung's disease, has a fever and watery explosive diarrhea. So when I think of watery explosive diarrhea, anybody ever seen Dumb and Dumber? My man's literally about to send that whole toilet into orbit. That's what I think about. Which of the following would Nurse Joy do first? So systematically, 1, 2, 3, or 4. What is the very first thing that I'm going to do, right? Am I going to administer antidiarrheals? Notify the physician immediately. Monitor the child every 30 minutes or nothing. We say B. This is an emergency. Emergency! And I'm not talking about the stuff that you drink that has vitamin C in it. So we all say B. Notify the healthcare provider. Because, hey, what is this? And then, hey, with this, it's associated with that and that. Right? B, go Bayside. All right, we'll pick B. We'll see what B is. B. Oh, there it is. B is the answer. For the child with Hirschsprung's disease, fever and explosive diarrhea indicates enterocolitis. a life-threatening situation. Therefore, the physician should be notified directly. Further important pointers is the history of patients with suspected HD, including clinical features of the Hirschsprung's associated enterocolitis, multiple episodes of overflowing constipation, and soft distended abdomen. Let's go. Wait, where are we going? Oh, I see what you're down. See, girl, Christine, I'm picking up what you're putting down. I got you. Shout out to all 58 of y'all hanging out in here. We got the question 16. Y'all got me to 22,400 likes. Look, let me tell you something right now. This is the most I've ever gotten on TikTok. And y'all are just pushing the bar, and I appreciate y'all. Make sure you guys keep liking. Make sure you guys keep sharing. We're going to go on to the next one. I appreciate all y'all. Hey, we're going to keep doing this. For everyone who was on the live Monday, I passed NCLEX. Hey, shout out to you, Kenya. That's what I'm talking about. Look, hey, so Kenya was in here telling us about her taking her exam, and she was super nervous, and we were just like, nah, girl, you got it. You know what I'm saying? So everybody right now, all 48 of y'all, show Kenya some love. Kenya, congratulations to you. Welcome to the shit show. I mean, girl, that's what I'm talking about. Welcome. Welcome to being a nurse. All your hard work paid off. All right? And now you can come out here and you can start doing your thing. Okay? So everybody show Kenya some love, because I'm telling you right now, that's one huge milestone that we all work very, very hard to do. And that's exactly what she did. So shout out to you, Kenya. And I'm just saying, that's love. Hey, that's what I'm saying. Nothing but love that's going on up in here. And that's all we want to foster. You see what I'm saying? We build each other up. We don't break each other down. So shout out to you, Kenya. Congratulations. Welcome to being a nurse. Now, since you in here, Miss, I passed my NCLEX, go ahead and answer this question right here. Go ahead and answer it right now. All right. Which of the following applies to the defect emerging from residual peritoneal fluid confined within the lower segment of the processes of the vaginalis? Oh my God, that is a lot. Inguinal hernia, incarcerated hernia, communicating hydrocele or non-communicating hydrocele. This one I don't know. And I ain't even gonna lie to you. I ain't even gonna front. Like, that's a lot. Shout out to all 56 of y'all. Hey, if you're new here, welcome. Make sure you guys participate. Drop up in there. If you guys are new, my name is Kevin. Go by the Boot Nurse on all social media platforms. We're doing NCLEX style questions. Literally don't even know a good guess. That's true. So let's think about this. Where's your peritoneum? Some people say C. Okay. So it says residual peritoneal fluid. So you can only get peritoneal fluid from your peritoneum, confined in the lower segment. Right? Some people say A. Some people say C. Misha's just like, bruh. That's exactly what that face looked like. Rigo says A. Betty says A. Okay, I'm guessing C. Ain't nothing wrong with guessing, because I'm telling you right now, when you get to your NCLEX exam, you will guess. And that is okay. Because sometimes you just will not know what it is. You just won't. You just won't know. Honestly, I'll be completely honest. I don't even like the way that this question is worded. But then again, it's just like, when you get to your exam, you're not going to like the way questions are worded. It's just how it is. But I did see people there's a lot of C's on here. A lot of C's and a lot of A's, but I think there's more C's than there are A's. So we'll go with the herd on this one. Rochelle just dipped out, so she decided she didn't want to be a part of it no more. So we'll go with C, and we'll see what the answer is. So this is another great one. When you're practicing, you don't know, and that's okay if you don't know. All right. So since you don't know, let's find out. So that way we can know in the future. Okay. So Geneva says B, but everyone else said C. Had a few A's in there, but I think there's more C's than there are A's. So we'll go with C. And okay, Bubble says C, so that's another tally for the C's. So let's see. Here we go in 3, 2. It was D, non-communicating hydrocele, right? It says with non-communicating hydrocele, most commonly seen at birth, residual peritoneal fluid is trapped within the lower segment of the processus vaginalis, the tunic vaginalis, whatever that is. And I honestly, it's just like, it's literally like out of my head. I ain't even gonna lie to you. There is no communication with the peritoneal cavity, and the fluid usually is absorbed during the first month after birth. Okay, there we go. Is that D? Did you pick D? You did pick D, didn't you? Yeah, I know. Yes, that's using context clues. Yep, that is. Right? So, hey, there it is. There's your answer. So, hey, even coaches get stumped. Didn't say I know everything, but I know a good amount of stuff, right? And so this is one of those ones. Honestly, I don't even remember seeing anything close to this, even when I was studying for NCLEX. And usually I remember a lot of good stuff from this, right? But hey, you will get those questions that you don't know. You will get them that you don't know. So now you got to go down here and see why, right? All right, let's jump to the next one. All right, so shout out to all 58 of y'all up in here. All right, let's see if they decide they want to give us an easier question, maybe, right? Mr. and Mrs. or Mr. and Miss Byers' child failed to pass meconium within the first 24 hours after birth. This may indicate which of the following: celiac disease, is it intussusation? Was it Hirschsprung's disease or abdominal wall defect? See? Yep, medical terminology is key. But then you got to think. So here's another thing too. If for people that don't know, with your test, with it being computer adaptive when you take the NCLEX, is the better you answer questions, the harder the questions they give you. Right? So just like I was telling everybody, like, hey, if they start giving you like easy questions, like, that are memorization, they're going to pull out questions that are hard if you're answering questions very, very well. So like if you're getting NCLEX style questions and you're at the analysis and the application portion where you're using your critical thinking and your clinical judgment and you're doing well, they're going to be like, all right, cool. So-and-so's doing really well. Let me go ahead and give you a hard question. I started the NCLEX with hard question. Hey, there it is. I started the NCLEX with pharmacology. Luckily for me, pharmacology was what I started with, like when I studied. And I was just like, oh, okay, cool, I know this. It's not even about knowing about the signs and symptoms. It's about how is that applied to taking care of your patient safely when it comes to pharmacology, right? Granted, you have to know, the ins and outs of it and, the signs and symptoms, but it's just like, how does that apply to your patient when they're presented to you, to the emergency room? Half my test was SATA and study. Oh, so you must have just taken the new one then. Okay. So you can get, I think, You can get, I think, 3 case studies. In each case study, you can get 6 questions. So that's a total of, I think, 18 questions total for the case studies. To me, I actually like the case studies because they give you everything. They give you everything that you need. All right, so let's get back. Let's see what y'all are talking about. So we got some B's and some C's. I see more C's than anything. Oh, yeah, I see way more C's than anything. So I'll hit C right there. All right, let's see what else we got. What else do we got? All right, shout out to all 68 of y'all in here. Hey, we're doing NCLEX style questions. Make sure you guys participate. Drop them down in there. If you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. All right, so that's what we're doing right now. We usually do nursing news type stuff, but it seems like everybody just likes NCLEX style questions, so we're going to do that. But yeah, general consensus. Looks like everybody's picking C. So, sirs and ma'ams, we're going to go with C, and we're going to see what the answer gods give us. And the answer is C. There it is. Failure to pass meconium within the first 24 hours after birth may be a sign of Hirschsprung's disease, a congenital anomaly resulting in mechanical obstruction due to weak motility in an intestinal segment. A history of the colonic obstruction, which might occur during the early neonatal period till adulthood, along with failure to pass meconium during the first 48 hours of life, which presents in up to 90% of affected patients, is highly compatible with the impression of HD. Okay, that was stressed. Yeah, I know. You got 8. 3 out of the 3 were 6 each. Okay, all right. 5 single question case studies. I actually like the case studies. Like I've actually been doing a few of them, like just kind of just messing around. That way I can sit here and be like how I can articulate when I'm coaching. And I'm just like, man, I honestly wish I had this NCLEX other than the other NCLEX that I had. Because, the select all that apply, you get them all wrong. You get one of those wrong, the whole answer's wrong. Like, period. You know what I'm saying? I love the case studies because it tells you if you get it right on the next part. It does. And then like there's another one where it's the drop down boxes where it's like it's like fill in the blank. It's just like, hey bro, like you get both. If you get both of them right, you're gonna get it right. Right? If you get one of them wrong, you're gonna get the whole thing wrong. But like with select all apply now within the case studies, like they're partial credit. You know what I'm saying? So there's that. But I like the case. Like, hey, look, hey, Kenya, you're the new. Oh, I'm saying you're the newest one, but like you just told us that you passed your NCLEX. You can let us know what's how that went for you. So all right, question 19. Hey, we got one more after this. Steve is diagnosed with celiac disease and experiences celiac crisis secondary to upper respiratory tract infection. Which of the following would Nurse Nancy expect to assess? All right. Is it lethargy, weight gain, respiratory distress, or watery diarrhea? Kenya says C. Okay, Sham says C. What else we got? Butterfly says C. Shout out to all 7 of y'all hanging out. Taylor says C. Correct me if I'm wrong, but B wouldn't be an option because there's not enough info, right? No, there's enough info there. Respiratory distress, okay, say D. C. D. So we got a lot of C's. I think we have a lot of C's in here. Yeah, so there's more C's than anything that I'm seeing. A few 2 D's, 3 D's. But more C's. Chrissy says C. Regal says C. Rosie says D. Beauty says C. Okay, Nelly says D. Okay. But it looks like we still got more C's than anything. Fallout says C. Or I said Fallout. I'll just say follow. C. Look, so it looks like we got more C's. We got more C's than anything. So, another thing. Let's think about this. This isn't me trying to sway your answer, but let's read it. Steve is diagnosed with celiac disease and is experiencing a celiac crisis secondary to an upper respiratory tract infection. Which of the following would Nurse Nancy expect to assess? So, if he experiences celiac crisis secondary to the upper respiratory tract infection. So based off of that verbiage, this is the primary issue. That's what it looks like to me. It is fluff, right? So, what are we thinking? A lot of people still say C. Edwin says A. Okay. Celiac disease is gluten intolerance, which is a GI problem, which is why I went with D. Oh, you went with D, not C. I got you. Tracking. I mean, that's fair. That's a fair assumption. That's a fair assumption. M. Brown says D. All right, well, but honestly, it still looks like we have, I think it's about even now. But it still looks like there's more C's than anything. Yeah, there's still more C's. Misha says C. Celiac crisis refers to severe diarrhea and dehydration. Denisha says C. Okay. Denisha. Oh, that's like Moesha. Anyways, so, hey, majority rules, it's C. Unless I have like 4 people that decide they want to put D right now. All right. I'm going to go for ABCs. C. PT student. C. Okay. C it is. Carly picked A. Maybe. Giselle. Chris, no, you didn't take E. Where do you see E at, sir? Sir. Now you get the finger. That ain't the answer, sir. That ain't the answer. All right. So C looks like, hey, that's all right. I'm picking C. That's what it is. I'm going for it. 3, 2. Oh, it was diarrhea, watery diarrheas. Watery diarrheas. Episodes of celiac crises oh my God. What is it? Persist. Oh, y'all already know what I'm talking about. I'm already tired. All right. By infection, ingestion of gluten. Look at that. Nelly just like spelled it out. Prolonged fasting and exposure to anticholinergics. I'm so smart. Look at you. Damn it. It's okay. It's okay. Future x-ray here. That's still great knowledge, though. Facts. 100%. It is always good knowledge, right? Where it says, celiac crisis is typically characterized by severe watery diarrhea. Celiac crisis is a life-threatening syndrome in which patients with celiac disease have profuse diarrhea and severe metabolic disturbances, right? So let's see why respiratory distress was the incorrect answer. Respiratory distress is unlikely in routine upper respiratory tract infection. Symptoms from other than gastrointestinal symptoms include recurrent aphthous ulcers in the mouth, sure, iron deficiency, anemia, ataxis, chronic headaches, and delayed menarche. Menarche. My oldest niece has celiac. See, look at that. You already know the answer because you already see somebody you already experienced somebody having it, right? So, question 20 would be a select all that apply question, right? It would be. Correction, LP and bridging to RN. Okay, shout out to you. Shout out to you. Shout out to you thinking about the symptoms of celiac heart. Yup. Boom. All right, cool. Here we go. Shout out to all 58 of y'all in here. Hey, here's our last question. Last question of the night. Appreciate everybody. Shout out to all those likes. Shout out to all those shares. So we'll do this last one. Select all of the apply. You know, the best questions that all of y'all love so much. So here we go. In pediatric gastroesophageal reflux disease, the immaturity of lower esophageal sphincter function is manifested by frequent transient lower esophageal relaxation. Lord, that is a mouthful. Which results in retrograde flow of gastric content into the esophagus. Which statement about the esophagus is true? Y'all. This is a tough question. A, B, C, D, E. Now, Chris, is it Chris that said that? Oh, let me see something. Chris, now you can choose E. Sir, now you can choose E. And you can choose F if you want to. Let's go. Let's go A, true or false. First part is all fluff, not needed. Facts. I mean, it gives you context. It gives you context of what you're looking for. But, they want to know if all these answers are true based off of what the patient presents. First part is all, yep. Mm-hmm. So, what are we thinking? Hey, what are we thinking? Hey, even if you get the answer wrong, that's okay because now we're going to read the rationale to figure out why. What are we thinking? This is a tough one. Especially if you don't know. True, but distractors, I read A, false. Or say A is false, okay. Okay, all right, Hayes. So we're not picking A. So is this true? It's an upper, it has upper and lower sphincters. Is B true? B is true. Okay, we'll pick B. C, what? B is true. Okay, B. Okay, you say E. We pick E. It is a highway for food and drinks to travel along to make it to the stomach. Mm-hmm. Is this Smart Edition? I don't even know. No, this is Nurses Labs. Veronica with a K. Veronica with a K. B and E. Okay. E is true. Okay. Say C. It says it lies anterior to the trachea. So we say C is true. Okay, so we'll pick C. So obviously it's not going to be F because it says all statements describe the esophagus, and we already said that A is false. So obviously we know that F is not right either. So you say B, C, and E. It's posterior. It is posterior to the trachea. Oh, is it? So is C wrong? Oh, it's post. So should I take that one off? Deletes. Oh, okay. My bad. Okay. Look, I'm just going off of what y'all are telling me. B and E. Okay. B and E, breaking and entering. No? Okay. No one got my joke? Whatever. Fine. Fine. Whatever. No, it's your. No, it's all good. It's all good. It's all good. I got you. I'm picking up what you're putting down. All right. What do we think? So are we sticking with B&E? Shout out to all 56 of y'all hanging out. Sticking with B&E? I think that's what we're sticking with. No one else. No one else. I've only had a few people kind of answer because they're like, I only got some brave ones up in here, and that's okay. Former cop dad likes to be. Hey, I'm just saying. I think it's good. Ashton. All right, Ashton. Thanks for coming in here. I'm glad you dropped your 2 cents in here when I've never seen you before. But shout out to you coming up in here, Ashton. I don't even know you. I just felt like saying your name like that. I have a friend. Her name is Ashton too. So agree. Okay, cool. So B&E. That's what we're going with. In 3, 2, listen. No, that's it. That's all we got. Look at that. Yo. Look. Shout out to y'all. Shout out to y'all. Gotten that select all that apply. Look, hey, we ended on a good note right there. Got the last question right. You see what I'm saying? You're the smartest human alive. Hey, straight up. Straight up. Way smarter than me. Way smarter than me. Believe that. Believe that. I got all those last ones right. Facts. Yes, you did. Yes, you did. More questions. Hey, the butterfly. That's it. That's the last question of the night. That's the last question of the night. Nurse Nelly is here. That's a great nurse. I already know. Facts. Nope. Butterfly. That's it. You were you not here when I was just like, yo, y'all got to keep me here, but we got to go to 20, right? So that, ladies and gentlemen, is the end of our NCLEX style questions. I hope everybody enjoyed that. Now you guys get to look at my crazy face. And for all the people that have never been in here, now you guys get to see what I look like. I look crazy, right? So shout out to all y'all. How y'all doing? I'm looking a little rough right now, right? I am that dude. I go by Kevin. Boot Nurse on all social media platforms. Make sure you guys check those out. So you've been trying to chart for the last 3 hours. Look, it's not my fault you've been over here participating, okay? Butterfly, am I trying to tutor you? Look, I tutor people all the time. I'm just saying, I do one-on-one coaching and I do mentoring and I do tutoring and all that stuff. Just go to thebootnurse.com, check out the website, and then look at the NCLEX mentoring and coaching. And if that is something that you want for yourself, it is there. Okay. Yeah. I appreciate everybody stopping by. I appreciate everybody hanging out. I came in late. I'm a dental student and wanted to see if I knew a little something. Hey, look. Okay. Yo, dental tech, dental student. Hey, I'm cool with that. So check this out. You can go to the YouTube. You can go to my YouTube channel, and every TikTok that I do, I put up there. So if you missed this one, I'm going to put it up there in the next couple of days, and you'll be able to see it. But by that time, I would have already done some other ones. So, and the website is thebootnurse.com. Thebootnurse.com. You can't miss it. You'll see me. You'll see my stuff on there. You can't miss it. Or if anybody is in need of taking the NCLEX, or should I say, if you're a brand new nursing student, started school this week or you start next week or within the next couple weeks, I have the 7-day NCLEX course. It is in its pre-launch phase. It's going for $48. There's nowhere else you can beat that. It's 80% off the current price. Once you get it forever. I'm just saying, it's there. Who gave me roses? Hey, shout out to you, Blessed KP. I appreciate you. I appreciate all the love. Just started my second semester this week. Okay. I'm taking med-surg finals next week. Okay. Hey, yo, you're going to be all right. You're going to be all right taking those finals. Okay. Y'all going to do just fine. All right. But yeah, so I'll be doing this again on Friday. But this will probably be my last Wednesday doing this. And the reason why I say that is because there's a lot of stuff I have to do in between the week. So I think I'm going to stick with doing TikTok lives Mondays and Fridays, but still the same time. So 5:30 Central Standard Time or Texas time for anybody that knows what's up with Texas. You know what I'm saying? Go Horns. Go Horns. You see what I'm saying? So I appreciate everybody stopping by. I need 10,000 people to love me and like me and follow me so I can actually do this from the computer. That way you guys can see it all nice and pretty, and, I ain't got to turn my phone sideways and all that other good stuff. You know what I'm saying? So, yeah. New York. Ew. Don't nobody want to go up there. They got rats up there. Big old ones. You know what I'm saying? 6'9". I'm just playing. No, I think he is. I think he's one of those. Like, yo, hey, so I just want to let y'all know that's the most likes I've ever gotten. I think the most I had before was like 21.4 or 21.7. And you guys got me to 21.4. And that's nothing but love. That shows me that you guys enjoy what I'm doing. And I'm doing this all for y'all. Because I wish I would have got this when I was in school. I wish I would have even known. I mean, TikTok wasn't even around, I think, when I was in school. But I wish I would have known, like, that there were just communities that were out here. You're in Florida right now? Y'all getting hit by a hurricane. Man, look, I'm going to need for you to get it together and, like, go, and go. You're in a hurricane right now. I don't even know what hey, look, that's what I'm talking about. Dedication. You know what I'm saying? You hear, and what is it? What's her name? Adalia is out there tearing shit up. Oh, okay. So you down there. So she ain't worried about it. She's like, y'all getting hit by that hurricane, right? So it ain't raining. Look, okay, all right. I see you out there. Cool. But yeah. Let me give Kenya some more love. Kenya, shout out to you if you're still here on conquering your NCLEX, because people don't realize it's not just about passing your NCLEX. It's a journey. Like, you got to think. You had to verbally and mentally say that you wanted to be a nurse. Then you had to figure out you had to figure out your prerequisites. You had to figure out everything to get into school. You had to do all those classes. You had to get really good grades. Then you had to get into school. Then you had to go through all the nonsense of school. A lot of y'all are still going through the nonsense of school. You know what I'm saying? And so then you're going to get to the point where you're going to graduate. Then you're going to study for NCLEX. And then eventually you're going to conquer your NCLEX. You want to know why? Because when you take your NCLEX and you conquer it, it's because of the journey that got you there. It's not just, if you want to pass something, get in your car and just keep driving and then pass a road sign. That's what passing is. But when you conquer your NCLEX, that is the closing of a chapter in a journey for you to excel in your profession. In a profession that you've been wanting to do for a long time. You can't just be like, hey, I want to be a nurse and you're a nurse next month. It doesn't happen that way. You got to do it. You got to do your prereqs. You got to do at least a year. You know what I'm saying? If you're an LPN, and if you want to go be the RN at least 2 years, you want to be a VSN, you do it accelerated faster than that. You know what I'm saying? So, it's a journey. Back in the day when people wanted to go, like, take other people's shit, Game of Thrones style, they had to go, like, on a journey for miles on end before they took people's stuff. So why wouldn't you adopt the same concept for yourself? You know what I mean? So, like I said, shout out to y'all. Hey, by the way, thank you for your service. I appreciate your willingness to serve. Look, hey, so first of all, I'll tell everybody I appreciate the support that anybody will give somebody that's in the service like myself. It's always really appreciated. And secondly, it's like, I've been in the Navy 16 years. It's almost time for me to go. I only got like less than 4 years now, right? 4 years, like 3 years and like 11 months and like 29 days or something like that, right? So, that's been a journey too. And that journey this way to my journey of becoming a nurse, everybody's journey. And this is mine. And my journey has led me all to all 40 of y'all that are hanging out here listening to me just run my mouth, right? But it's all for y'all, right? So I'll do my last little plug for myself. If you've never been here, my name is Kevin. I go by The Boot Nurse on all social media platforms. Make sure you guys check me out. If you guys need NCLEX help, check out thebootnurse.com. And I do one-on-one coaching, so you can find that out over there. And if you need help, check out the 7-day NCLEX course if you're a brand new nurse and you want to get an NCLEX course for $48. Once you get it forever, and you get all the updates that come with it. So check that out. Feels like yesterday when you left. Yeah, it does. 16 years. Who would have thought, right? But yeah. Last thing I'll say to y'all is be kind to yourself. Nobody's going to love you more than you love you. I promise you that. No one's going to love you more than you love you. So don't beat yourself up about where you are. Appreciate what you're doing for yourself, because only you will be able to get you through that. You know what I'm saying? So give yourself some perspective, right? Because you could be in Ukraine right now. I use that as an example all the time. You really could be. And I'm not talking about fighting it. I'm talking about you could just be a regular person living there and your whole world be turned upside down. But you live here, or you live somewhere else where, we have the opportunity to not have to deal with that. You know what I mean? So anyways, I'm off my high horse. I appreciate y'all hanging out with me. Make sure you guys share. Make sure you guys follow me and all that good jazz. And until then, I will see each and every one of you guys, hopefully on Friday at 7:30. So bye.